I'm pumped to have you in here.
Yeah.
Very pumped.
Man. I'm excited, man.
You've saved me countless times already from my my dizziness and vertigo, where I'd be falling over myself if it wasn't for you. So I appreciate that.
No problem, man. Anytime.
And then obviously John's been working with you.
Yeah, I tore up my pec a while ago. You fixed it up in 3 sessions instead of months and months and months.
Absolutely, man.
Took care of it real quick, and now I'm seeing you again because something else is wrong.
That's usually it happens, in this realm of fitness and lifting and stuff like that. That's usually how it happens. Something goes wrong, and then a couple of months later, well, this is wrong now. So let me get that fixed. But I try to get the athletes quickly back into the gym and training again.
Mm-hmm.
Yeah, it seems to be a trend that bodybuilders just stay broken, I guess you could say. You see so many injuries, I'm sure. You see, and a lot of them probably have trends. So a lot of the injuries are probably similar between athletes because everybody starts making the same mistakes or is making the same mistakes.
You know what it is? It's basically cumulative trauma. Especially with bodybuilding, it's the same motions over and over again, and obviously we're pushing each time to get a little bigger. So we're pushing the weight up, we're pushing the repetitions up, and that hardship causes a little bit of micro trauma to the muscle and creates inflammation, and which is what we're after, right? We're trying to hypertrophy the muscle, so we're not going to keep lifting lighter weights. We're going to keep lifting heavier weights, and inevitably you're going to strain the tendon or the muscle tissue, and that's going to create some scarring, and you're going to need somebody to clear it out of there and get that muscle functioning correctly again.
Yeah, I feel like that's something a lot of people don't understand is that what we're doing in the gym for bodybuilding, it's a very unnatural thing. Our bodies aren't made to be growing the rate they're going, lifting the weights they are. Mm-hmm. So you could be doing everything right sometimes, and that microscopic tissue that's damaging, the tendons are never going to grow and hypertrophy at the same rate as the muscle tissue. So something's going to go wrong. Maybe you didn't do anything wrong.
Well, that's a common question I get is, what am I doing wrong? Well, you're not doing anything wrong. You're lifting. You're lifting. You're trying to get bigger. You're trying to get better. Unless I see a really bad something going on with your posture or a real bad asymmetry, there's nothing really, people are like, well, how do I prevent this? There's certain rehab exercises you could do to prevent it. But, when you're in the zone, especially if you're getting ready for a show, you're training in the off season to try to get bigger, you're going to try to push the envelope a little bit and you're going to get that strain here and there.
Now, what would you say is the best, I guess you could say, preventative measure? Is it getting a better understanding of proper form, proper mechanics earlier on? What's the best way to prevent these long-term injuries? I mean, because listen, everybody gets injured.
Absolutely.
It happens to everybody.
Yep.
At some point, I explained to all the younger guys, you'll do an ego lift, something will happen, and you'll be feeling great. Mm-hmm. And it's always I get hurt every time I'm feeling great.
Yeah.
What I do? I threw my lower back out. I came to see you.
Yeah.
Threw my lower back out. Everyone's like, "What are you doing? Deadlifting? What are you squatting?" Mm-hmm. No, man, I was doing fucking side raises with 25-pound dumbbells. It's ridiculous.
Yep, absolutely. Yeah, when I used to get my injuries getting ready for shows, it was always when I was in a groove, feeling good, everything was going good, and all of a sudden it's like, oh, shit, there's my shoulder now hurting. Mm-hmm. But I would say, the best advice is obviously, when you're first starting out, make sure that your form is right. Make sure you're starting off with a good foundation. But what I find most common with lifters is hydration is super important.
So
your muscles
peri-workout in the middle of the workout as well.
Absolutely, and hydrate the day before. If you're trying to hydrate that day, it's too late. You hydrate the day before. That's when and the nutrients too. The nutrients that you take the day before is what's going to affect your workout the next day, not what you do as much that day. So hydration is super important. Stretching, is
the worst.
I know, man. It's because you just want to get in there and get the workout done. But if you could stretch out a little bit after, I'll tell people, listen, jump on the bike, jump on the elliptical, something 5-10 minutes, feel your body temperature go up, then go into your training. And then afterwards, if you could do a couple little, even if you just stretch out that body part, just to get that fascia really stretched out a little bit again, because you have to understand it's been under pressure for an hour, 45 minutes under intense pressure. If you can just get that fascia to kind of stretch out a little bit after, you do your body a good service.
So, because I've heard a lot of myths and I guess you could say articles, whatever, stating that pre-workout stretching is good, but you don't want to stretch a cold muscle.
Exactly. Yeah. That's why I tell people.
That's my theory. It's always been is never overstretch a muscle before you're going to train it. Mm-hmm. But something like the active stretching, like taking the bands right around, fully around you, warm up the muscles, and actually well, real lightweight or the cardio or something, just get some blood in there before you really start training it.
Just get the blood in there, get your body temperature up before you start,
Yeah.
and then go into it.
It's basically like waking up going, hey, we're working right
That's
now.
it. We're getting going. Right. Wake those muscles up that you're going to do.
Yeah.
Wake the antagonistic muscles that you're going to be working, and then get into your workout.
Yeah.
Cool.
You know, before my leg days or any of my clients, I always put them on quad extension. Now, obviously, it's the most shearing muscle workout in the world for your knees. But what I'll do is I'll have them on a really light weight because, you know, the body always wants to naturally load the joints because you can stand up all day and never have a problem with it.
Right.
But that quad extension with 30 pounds on it for anybody, it's basically saying, hey, quads, you know, wake up.
Wake up.
Wake up, we're going to start using you now. Gets the blood in there. So now it's not as natural to load the joints when you put them on a heavier squat or a leg press where it can detriment them.
I always started my leg workouts, and you know, my legs were my best body part, and I always started my leg workouts with leg extensions. And I know that it's a shearing exercise for the knee joint, but I didn't feel like anything else would warm up my quads and my knees like extensions. And I always finished my leg workouts with lunges, walking lunges.
Yeah.
Barbell or dumbbell? Or you
No, I
switch
used
it
to
up?
do it with the barbell.
Yeah?
on my
You felt
back.
that's more effective as a walking lunge than
You know,
dumbbells?
I never really, you got to remember, I'm 53.
You're old.
54.
You're the
so
old
I
school
used to be
generation. I love it.
Old school. So I never used to see guys doing it with the dumbbells.
Okay.
You know, it was always the barbell in the back and do the walking lunges, Tom Platz and all those guys. So that's what but I didn't get sore unless I did the walking lunges.
Gotcha.
Yeah.
It was that little end bit you needed to finish it off.
Yes.
Yeah.
Yeah. It was always walking lunges.
Big Meadows tip that I picked up, he said, you know, the younger guys don't realize it. He's like, when I got older, I used to see guys rubbing all types of oils and liniments on themselves before they trained, and I never got it. He goes, but now I get it. So one of his tips was, even if you don't have elbow or knee problems, and you can correct me if I'm wrong, or you know, if you think differently, but almost like an icy hot solution to kind of push more blood flow to those areas to get it warmed up quicker before you start doing presses or any type of squats.
I've never, I used to advise people if they did have issues there to wrap them just for the same effect, just to keep them warm. But yeah, some type of liniment or oil to rub on there. That works as well.
Yeah, I've been using wraps like those. What's the blue ones? You know the blue ones? Reband, REHBAND.
Okay.
Send the check.
Yeah.
Send the check.
That's it.
I've been using those since 2012.
On
Once
your
again,
elbows?
no knees.
Okay.
I was using elbow sleeves. I thought it was just too much.
Yeah.
Once you start getting all wrapped the fuck up,
Right,
like
I
from
know.
When you
wrist,
walk into the gym, look like Iron Man. That's a problem.
holy shit! I'm not a power lifter. Like I'm walking a couple train sessions. I had wraps. I had
all
elbow. I had a belt. I had knees, sleeves. I was like, what am I
I
doing?
used to see the old guys like that. I'd be like, fuck, I'm never going to be like that.
Yeah.
Next thing I know, I'm wrapping my knees and shit. I never wrap my elbows, though. I never wrap the elbows.
I don't know. You know, it definitely helped. I felt it added like a little bit of springiness.
Yeah,
and it
support.
felt good.
Gets out of the hole.
That's really what it is for me. It's mental for me
Yes.
because I don't go crazy past what
Yep.
I can do.
Right.
It's just that little bit of, hey, I got you.
Yes.
Don't worry about it.
Absolutely.
We're not gonna
Yeah.
rip this shit in half
That's
right
what
this
they're there
second.
for. Yeah, exactly.
But I don't know. The knee sleeves always felt great.
Yes.
Keeping the knee warm. I would always warm up with hamstrings, and then I would move to quads. And right when I'd start doing any type of a squatting motion or anything like that, sleeves went on, and,
Yep.
and for the rest of the workout they stayed on.
Yeah.
And it always felt great because of that extra warmth and security.
Right. That's so funny because, like you said, I warmed up with hamstrings and then I went into quad. There's no real, there's so many, gurus out there that say this is how you have to train. This is the exercises you got to do. To me, it's whatever works. Everybody's body's different, So you might like working out with, let me do my hamstrings first. I like doing leg extensions. John likes to recommend his, clients with leg extensions.
Like to run around in circles.
Yeah, everybody's got a different,
Yeah.
kind of prep to working out, and I think whatever works for you and whatever feels good to your body is what you should do.
It's all trial and error.
It's it.
Really,
Yeah.
that's the diet too.
Absolutely, man.
Everybody's different.
Yep, exactly. That's a good point. That's diet too. It took me, all my years of competing. I mean, it took me a long time. I didn't get my pro card till I was 41.
Wow.
And I was competing since I was 18. I had to take a break when I went to school because of my studies and getting my practice together and stuff like that. But, it took a long time to know what works, what I could, how I carb loaded, how I carb depleted. Did I have to knock out my sodium? So training takes just as long, to really figure out what works. Like now I'm at a point where I know I can maintain what I have now if I just do this, A, B, and C. Yeah. But it took me, a long time to figure that out. So it's a big trial and error, bodybuilding and fitness,
Yeah. It's hard to even set up a a controlled experiment for that to see what diet is truly best. Because since everybody's different, and you don't know what everybody else is going to do those other 23 hours of the day when you don't see them.
Right.
Go, did you stick this diet 100%? Is 100 grams of carbs perfect? Well, maybe it is for you, but not you.
Right.
You're 6'2", you're 5'2". You know, there's so many variations. You got to figure out what works for you.
Yeah.
And, you know, even down to, I'm a big believer of, you know, there's like the ectomorphs, the mesomorph, endomorph, right? Well, people say, I'm an ectomorph, I'm a mesomorph. But the way I see it is, say your mom's an ecto, you're a meso, you might have the bone structure of, say, an ectomorph.
Right.
And the muscle tissue of, say, half a mesomorph, and then your grandpa was an endomorph, you know what I mean?
Yeah.
So there's no, I'm this one.
There's a big mix in there in that DNA, you know?
Yeah, you might look like the bone structure, because it's pretty hard to change the bone structure.
Yeah.
But when it comes to the actual muscle tissue of it, who knows what you are, and you got to figure out, you know what, my calves respond better to high reps.
That's it.
Yours are the lower reps. My chest responds better than high. You know, it's all these different variations.
Yeah, and you see it with your training partners, too.
Yeah.
I mean, I used to train with this little guy. I can't remember his last name. His first name was Ken, a little Italian guy. And we used to do legs together because he wanted his legs to grow. And he's like, I'm going to do exactly what you do because your legs, your legs look good. I'm going to do exactly what he would do more weight than me, do the same exercises, and his legs would not fucking budge.
Took more to stimulate any type of
more volume.
growth.
Right. And I was always a volume guy, and it just didn't work for him. When he started going less volume, less reps, more weight, that's when his body started responding. So like you said, it's a matter of, trial and error.
And it takes you a whole career of 40 years to figure it out.
Absolutely.
Yeah, you can't figure that stuff out in a day.
No way, man.
Yeah, that's like we said with the diets. We had our buddy Oliver on, who's a vegan, and we had a lot of people talk to us. I mean, I don't know. I'm sure you got a lot of questions, but a lot of people were hitting me up asking me about what my thoughts, even after the podcast, what my thoughts on the vegan diet were. Obviously, that's the next fad, I guess you could say, be, along with keto the last couple of years and what keto's doing now. And listen, in and out. I tell people I've done keto before. I can't sustain it long term. Right. I just can't. I start eating carbs, I blow up. Vegan diet, I couldn't see myself doing it. I don't respond well to all carb diets.
Right.
And vegan diets are primarily carbohydrates.
Yeah.
And when I asked Oliver, and I love Ollie, but I asked him, I said, what do you recommend for a client if you were working with somebody and they don't do well with carbs? How do you transition them into a vegan diet? He couldn't really give a straight answer.
Right.
And I'm not saying anything against Ollie, but you really can't because scientifically, you can eat tofu.
How much
That's
tofu
it?
am I going to eat?
Well, even so, the tofu, then how much soy are you eating?
Right.
Yeah,
then you're really messing yourself up.
So, and I'm very pro balance. I used to be super strict, regimented. Whatever my ex-coach told me to eat, I was fucking eating it.
Yeah.
Tilapia, red potatoes, not white. Okay, I'll eat red potatoes. Like it really made a difference. But the point being is, I was always super strict on what I ate, and it almost made me like a mental Nazi, and I couldn't do it anymore. Just I had to break free of it. So when I got linked up with my second coach, who was the doctor, he's the one who kind of said, after about a year and 2 years of working with him, he's like, you got to stop tracking your food. I was tracking every gram that went into my body for like 3 years straight. He's like, you got to stop. It's mentally fucking you up.
That's stressful, man.
Oh, my God.
That's really stressful.
So he's like, you got to stop, because I wasn't competing anymore.
Right.
He's like, you got to stop. Just learn to eyeball things, understand what you're eating, because you know already.
Right.
He's like, you know already. You've been doing it enough. Just understand what you're eating and then just apply it.
Right.
He's like, you know what to do. And then that's when I started to break away from it.
Yeah.
I mean, I've said it a couple times on different podcasts. Single guy, I want to go have a beer with a girl.
Yeah.
I don't want to have to go, oh shit, meal 5 is on the way. I can't do it anymore.
Yeah.
And I'm not competing, and it's obviously different for professional athletes that are getting ready for pro shows and different for people that have aspirations of becoming a pro bodybuilder.
Right.
But I think the moral of the story is, for dieting, balance is key.
Yeah.
Maybe do a couple of vegan meals and days and cut a
respond.
little bit of red meat out of your diet, because
Right.
I'm sure less meat is not a horrible thing for all of us, because we eat too much of it to begin with.
That's what I was going to say is the biggest thing you can take from a vegan diet to incorporate it toward your health is the average person doesn't eat enough vegetables.
Right.
Just eat some more vegetables, and that's really it. You know what I mean?
Yeah, I don't know about you, but I mean, back then, I know the
We're all
old school
bad
guys,
with it.
the old school guys especially, were not eating veggies, from what I understand.
No.
Potatoes, man. That's what we did. But,
potatoes and milk.
It was a big meat thing, way back. And what changed me is my mom ended up getting colon cancer. Thank God she's still with us, and she's cancer free for the last 8 or 9 years. But her main thing, the doctor says you need to cut out your red meat. I'm Cuban, so it was always steak and rice every night. So we started cutting down, but I saw that movie Game Changers because everybody was, my patients were coming in and talking about it and stuff. And I'm open-minded. Same with techniques and soft tissue techniques and diets. And I'm always willing to, well, let me see. And I'll try it because I'll never give advice if I don't try something. And I was like you, I couldn't sustain that vegan diet. I needed my chicken. I needed my fish. I needed something to fill that protein void that I couldn't get from the beans. And I did. I tried it for probably almost a whole month and got leaner, lost some weight, felt a little different. I wasn't like, like in the movie, the people like blown away by
within
how
a
they
day.
feel. Yeah.
Wow.
I didn't get that. I didn't get that quite effect, but I did feel better on it. I can't say I didn't, but I couldn't sustain it.
Yeah, well, the problem is, too, with that is there's really no way to get a full amino acid profile unless you're supplementing something.
Right.
But you should never have to supplement a diet if it's not a complete diet.
Exactly. Especially in the off-season.
Exactly.
You should be getting enough, protein and should be getting enough amino acids to fulfill everything that you need,
My biggest problem with that documentary was it's not a government study. It's a privately funded show. You know what I mean?
Right.
It's a privately funded documentary. So it's always going to lead more toward one side where you ate somebody ate the first piece of broccoli and they go, wow,
yeah,
I feel great.
Right.
I'm jacked up.
Yeah. But I think, I think everything, unfortunately nowadays, that's why I'll tend to try stuff out. Because I think everything, I always tell patients, when they go to the orthopedic, I say, listen, if you go to a butcher, he's going to sell you meat, right? So if you're talking to a vegan, he's going to sell you on that vegan diet. If you go, talking to a keto guy, he's going to sell you. So I think the best advice out there is just try everything, see what works. Because like we're saying, something works for you, it doesn't work for me. So I think variety and trying out everything is probably the best way to get to that end goal of like, oh, okay, this is what works for me. This is how my body changes. This is what works.
Yeah. And in saying that, trying it wholeheartedly is the best way.
Absolutely.
Because there's a lot of people that I know that'll try it half-assed or they'll try bits and pieces of it, wonder why it's not working and stuff like that.
Right.
So I have family members that are doing keto or have done keto, whatever, and they're drinking wine. No. I'm like, you can't drink wine.
No, you can't do
I'm looking at him. I'm like, you say you're a keto. You say you're eating only meat and veggies and shit like that, but you're fucking drinking.
Yeah.
You're drinking. What are you doing?
Right.
You had a piece of pie yesterday. What are you doing?
It's like doing a pre-contest diet, and they're 5 weeks into the pre-contest diet, and you're like, what are you doing? You're not looking like you should be.
What are you doing at McDonald's?
Yeah, well, I'm just, just one French fry. That's not going to do.
It all adds up.
It all adds up quick,
man. Absolutely. Yeah.
Yep. That's the biggest thing with somebody who wants to lose all the weight and say, why didn't I lose the weight yet? You didn't put it on today either. You know what I mean? It took a lot of time to put it on.
Yep.
But now that you decided to make this life change, you think it should come off immediately.
Absolutely.
It'll come off slower than you put it on.
Yeah.
It's a lot quicker to eat 1,000 calories and lose 1,000 calories.
Yeah.
You know?
Yeah. I mean, this is the leanest I've been, just personally, through a holiday season. Just because once we started the podcast, I started dropping some weight. I wanted to drop weight. I wasn't feeling good. Right. I dropped from about like 230, 225-ish down to 197. Oh, wow. 195 was like my low weight one morning. But over the holidays, eating what I want, drinking pretty much every weekend, because that's how it kind of goes, unfortunately, with the holidays. And then going into now the end of January, where I'm just starting to get my feet wet again, back into like doing some cardio. And I took cardio out. Right. I wanted my body, and a lot of people don't realize this, and maybe you could back me up on this. A lot of people don't realize you do cardio constantly. Your body's always trying to maintain homeostasis. So your body's always trying to stay level. Right. So if it knows that you're doing these cardio sessions every single day, eventually it's going to plateau, and it's going to say, oh, this is the standard now.
That's it.
So for me, I took cardio out. I wasn't really doing a lot of cardio. Still training heavy. Still training all the Mountain Dog, Meadows stuff.
Yep.
So now I'm like 202. So I only went up like 5-6 pounds.
Right.
It hasn't been that.
But it was quality.
Yeah.
I mean, over the last couple of weeks, definitely some fat.
Yeah.
Definitely some fat. But, that's what kind of what we're saying, like off-season type training. Like, that's my off-season right now. Yeah. My off-season was enjoying my food for November, December, and then I got a bachelor party in April. So Papa's got to keep it tight now.
Right, that's it. You got to peak for that.
Yeah.
That's it. Now I got to get ready for that now. So now I'm going to start adding the cardio back in. And it's about knowing your body. It's about understanding what you have to do to get to your goal. And like you said, it takes trial and error. It doesn't just happen overnight.
Yeah. But your body will change better for that too. Like I know when I used to get ready for shows, that in the off season I barely did cardio because I felt like if I did all that cardio during the off season, now when I wanted to turn it on during the pre-contest diet, my body wouldn't change because it's accommodated. It's
Yeah.
like, okay, I know what's coming. I'm going to just stay right here. And I'm not going to. So, yeah, I think, shocking your body. And, the good thing with the cardio now is the Tabatas. A lot of people do more HIIT, high intensity.
That's what I do.
That's great. Great
I do it on the elliptical, like the at Bev's, the glider one,
Yes.
not the stand-up elliptical. I hate those.
Right.
But the glider one, I'll do that. I'll go 30 seconds all out, 30 seconds at a slower pace.
Yep.
I'll do it 15 times.
Right.
And then I'm toasted by the end of that.
Yes.
And then that's my cardio for the day. It's better than sitting on the stairs for 45 minutes.
Oh yeah.
Yeah, that's why they say that basketball players and soccer players and stuff, they're so lean because they're constantly doing Tabatas. They run hard for a few seconds and then they're jogging, and then they run hard again and then they're jogging. You never see a fat basketball player, you never see an out of shape soccer player. They're always in good conditioning, and that's their cardio.
I guess that's why that's why all the running backs in the NFL are jacked up, most of them, because it's those bursts of energy, and then they're walking around, and then they're doing it again.
Exactly. Yeah.
That's a big thing I preach to all my clients too. Is what you were saying, Nick, about you don't want anybody to get used to it to make that cardio every single day be homeostasis.
Yeah.
You want to lose all the weight, build some lean muscle tissue, and do as little effort as possible and eat as much food as possible to maintain that look you like for longevity. You know what I mean? So if you have to do cardio once, twice a week, eat kind of as much food as you can possibly handle. Train with weights 3 times a week, but you're maintaining a physique that you wake up in the mirror and you're happy with. That's perfect.
That's it, man.
That's all you need.
Yeah.
For me, my cardio right now in the off season is, I'm big for cardio in the sense of boosting your metabolism up, so you synthesize more food, etc. But I'll just walk the dog a couple times a week. But nothing simple.
But it probably varies, right? Like if you look at yourself in the mirror and you're like, you know what, I need to kick in my cardio a little bit, or I need to change it up. You could do it, and then your body will change.
Yeah. For me, when I'm bulking, I call it my minimum system. So I'll eat all my good meals. If I want something else, I'll have it. If I want a donut, I'll have it. I want this, I'll have it. I see myself get a little fat a little bit. I cut the shit for a week, up the cardio a little bit, and it's back to normal.
Yep.
Because I set that as my homeostasis point.
Right. Absolutely.
That's what I have to do. I have to start. I this morning I just had a regular shake. I gotta come down. I was getting too comfortable with the carbs the last couple of weeks, and although the weight hasn't gone up a lot, I still want to keep it somewhere because I know what'll happen. I'll blink and it'll be June, and I'll be like, I'm not ready for bathing suit anymore again. So
it's a different look, right? When you look in the mirror, you're like, I'm getting a little watery.
And you like almost can like. Go like that against your stomach, and you just see the ripples. It's like weird.
It's a different look. Yeah.
It's like, that wasn't there a couple weeks ago. We got to get this out of here.
Exactly.
When you really can't justify, that's an ab, I think.
Yeah.
Then there's a
Well,
problem.
I told you when I was heavier, the best way to show an ab was I'd remove all of my ribs, surgically by myself.
Of course.
I would lean and I'd fart, and one ab would come out, and that'd be
side.
it. I would walk around the pool like this the entire time.
I was gonna stay right there.
So let me talk about your generation, kind of when you got into bodybuilding, because I'm dying to talk to you about that.
Yeah.
My dad showed me pumping iron. That's kind of what got me into it. I was a fat little kid.
Wow.
My dad showed me pumping iron. He's like, hey, check this movie out. I watched it, loved it. Started getting my mindset ready. Like a year or two later, that's kind of when I started my transformation of dropping weight, learning what a carb is, what a protein is, what a fat is, everything like that. So I think that everyone's too soft now when I look in the gym.
Right.
All the younger kids, all this stuff. I mean, everyone's looking for an easy route, easy way. Yeah. No one wants to put in that goddamn work. Yeah. All the kids are jumping on stage. There's a young kid at Bev's. Super nice kid.
Right.
Gave him a lot of advice. Talked to him for a while. If you're listening, hope you're enjoying everything.
Send the check.
Send the check. Yeah. No name. He wanted to jump on stage in like 3 months. I said, "What are you gonna do?" He goes, "Classic." I said, "You got to build a foundation, man. You got to understand." I said, you're natural? He goes, "Yeah." I said, "Okay." I said, "Well, you got to understand the guys you're going to go against. Right. The guys you're going to go against have been training for a while, or they're on massive amounts of shit." Right. I said, "And you're not going to be able to compete with them." Yeah. I'm just being realistic to you.
Yeah.
I was super let down when I competed because it was kind of like a different swing of things. Getting back to...
What year was that?
When I competed?
Yeah.
I competed in 2013 and 14.
Oh, wow. Okay.
That's when men's physique didn't really know what they were looking for. So I was going against bodybuilders.
Right.
I was going against classic physique guys.
Yeah.
Top 10 in my class were about 200 to 215. Physique class A, so that's up to 5'7".
Right.
I was 150 on stage.
Christ.
Wow.
So
yeah, that's tough to...
couldn't compete with it.
Yeah.
50 pounds of muscle.
50
pounds of muscle.
Yeah.
I was like... I looked at them. My mom sent me a picture of me next to all the guys, like when they took a picture of everybody in front of the stage before we competed.
Yeah.
She goes, I got to be honest with you. We got a problem.
Even the physique guys now, man, they're big guys.
Yeah.
The physique guys and the classic physiques, they're huge. If people are like, well, what would you do if you went back to competing now? I would do classic because there's no way. Even the 212 guys are just phenomenal bodybuilding. They're like 5'6", 5'7", and they're 212, and they're coming down from like 240.
They're fire hydrants.
I mean they're just huge individuals.
But when I was down with Flex, I remember it was like a week or two before. It was a week and a half before the Olympia.
Mm-hmm.
I mean, this dude, I couldn't see an ounce of fat on him.
No.
He was diced and peeled, and I think he was like 2 pounds overweight. I was like, what is going on right
Where
now?
are you getting that from?
Right, man.
You got 2 pounds to lose? Is that really what you're about to do right now? Okay. Must be a cakewalk for you.
Right.
So it's a whole different generation now.
I got started back in '84. I was always a baseball guy. I played baseball since I was 5 years old, right through high school.
You grew up in the States?
I grew up in the States.
Okay.
Yeah. I grew up in Massapequa and had a scholarship to Adelphi University. And the summer of my senior year, when I was going to go into college, my cousin, who was living in Florida for a while, came home, and he was jacked. And I was like, wow, dude, you look unbelievable. And I could still see the magazine cover. And I think everybody that you talk to, the first time they, like you, Pumping Iron, that was your first click.
Yeah.
So I remember seeing the front cover, and it was Samir Bannout with
Okay.
2 beautiful girls on each side of him. And he looked unbelievable. And I was like, I want to look like
As
that.
a young male, you look up, that's like the alpha male. That's
exactly. He's got 2 girls, right, on each side, and he looks unbelievable. He's ripped. He's in great shape. I started looking through the magazine, and I just became – I'm a little OCD as it is.
Yeah.
And I became obsessed with the gym, obsessed with bodybuilding, obsessed to realizing that goal that I want to see my body. I want to look like this guy. Mm-hmm. And I think that's important too, is to have that vision of what you want to look like. And that's how it got started. And I ended up not going to, and my father wants to, he was like, oh, because I ended up not going to practices, and I ended up losing my scholarship. And I remember telling my mom, she got the letter, and that I haven't been showing up practices, and I'm not going to be following through with my scholarship. And she's like, "What is this?" And I said, "Ma, I don't want to play baseball anymore. I want to lift weights." And my dad's dream, because he played baseball in Cuba, my dad's dream was for me to become a major league ball player. That was his dream for me. Obviously we all have our different pathways and stuff like that. And I'm like, Ma, can you tell him for me? And she's like, no, you need to tell him. And
probably the heart-sinking moment of your
hardest
younger
thing
years.
To crush somebody's dream like that. And I told him, I'm like, Dad, I don't want to play baseball anymore. I'm just tired of it. And he looked at me and he just kind of walked away. And he was upset for about a month. I mean, we were walking past each other in the house, and there was no
grazing elbows.
No communication. And then he sat me down finally. He says, listen to me. He says, I understand. He goes, and I'll support you in what you're going to do, this weightlifting thing, because he never lifted a weight, never understood it. He says, but that weightlifting thing will not be able to support a family, will not be able to buy you a house. He says, you need to do something that's going to give you a career in something. And that's when I became an exercise physiologist first, and then I went on to chiropractic college.
And where did you go to school? You did that at
Adelphi. I stayed there. Yeah. I stayed at,
was it a good program?
It was a great program. Yeah, and I learned a lot. And I started off as an accounting major because both my parents do accounting. And man, I just wanted to take some, because I was into the anatomy. I wanted to take some type of physiology anatomy class. And I went to my guidance counselor, and they were like, no, your schedule is completely full. You can't. So at that point, I was like, no, I want out. I don't want to do accounting. I want to do something with the human body, because at that point, I was so into it.
And what age were you by then?
18.
Okay, yeah, so still young.
So
Just turning 19.
Which is crazy, because a lot of people don't really understand or know what they want to do at that age.
That's an important point. And I have 2 sets of twins. I have twin girls that are 19, Giovanna and Dominique, and then I have my boys, Antonio and Joseph, they're going to be 13 in February. And my girls, as they were getting older and getting into their sophomore year in high school, I said to them, listen, you need to start thinking of a career path because I'm not letting you go to an expensive college not knowing yet where you're going to go. You can figure it out, but you can figure it out at Farmingdale College and Nassau College. I'll let you figure it out there, but you're not going to go to a $40,000 or $80,000 a year school and trying to figure it out. So thank God by their junior year, they kind of knew, and by their senior year, one's going to become a vet and the other one's going to become a PA. So I think that career path is important to know, especially as you get younger and as you get older, and especially in high school and stuff like that. It's important to kind of know your direction and say, okay, I really have a passion for find your passion. That to me is important. I think if you find your passion, you'll always be able to make money doing something that you're passionate about.
Yeah.
It's tough though. And I'll say it's tough though because a lot of kids go to different schools, like you said, the expensive schools, because they're looking not necessarily for the academic part of it, but it's ingrained in their mind at a young age that you're supposed to go to college, and those are when you're supposed to party and hang out and do all the crazy shit.
And that's
but meanwhile, it's not.
No.
You're going to college to learn and to get educated for whatever it is that you want to do in life.
The rest of your life, absolutely. That's the way I explain it to my girls, Nick. And I said, listen, you could party, and I'm sure you will because every young kid does, but that's not what college is for. College is setting you up for the rest of your life. It's not setting you up for 4 years of partying, because then you're going to come out at 22 and you're going to look and you're going to be like fucking living with your parents, and you're going to be like, shit, what did I do those 4 years?
Yeah.
It's setting you up or it's setting you back, because then you're living with the parents and now you have a bill.
Mm-hmm.
You got a bill for all that debt that you didn't do anything with.
Yeah.
I did 2 years at Nassau, so I got my associates at Nassau,
right?
And then I transferred. I went to Quinnipiac for my remaining 2 years to get my bachelor's. So it was a good move.
Yeah.
Would I do it again? Probably not.
Right.
But it also, it's almost like that fate thing, where if you didn't take those steps, would you be sitting here today?
It's crazy.
Would I be doing the podcast with John? Would I have known all the bodybuilders? Because that's when I got my bodybuilding stuff all done, because I was up at Montanari and I was training with those guys and Centopani and everybody up there. So it's like, would my life be the same right now? Probably not.
Right.
So I don't regret it in that aspect, but I do regret it in the sense of going away to school, being miserable, because I'm not a partier. I'm not somebody that I like going out with my friends.
Yeah.
Like, I'm the kind of guy, I'll go out if something's going on and it's fun. Right. Great, let's do it. If it's not, and we're just gonna aimlessly wander around, I could be in bed.
Yeah.
I could be in bed relaxing, because I don't want to be out just doing nothing.
Yeah.
So going away to school was interesting because it really showed me the sides of the collegiate force and what its byproducts are going to be.
Right.
And a lot of these people, they're accounting majors. They're coming out like that. A lot of these fucking kids, I would never trust with a dollar of my goddamn money. Yeah. It is insane the amount of shit that I saw them doing. And mine was a small school. I can only imagine at bigger schools where there's bigger problems and bigger assholes.
Yeah.
So for me, I think at some point when I have kids down the line, my biggest recommendation to them is going to be, you're not going to know what you want to do. You may, like your girls, you may get lucky. You may get lucky at a young age and have that ingrained in exactly what your passion is already right off the cusp. If so, fantastic. Run with it and don't stop. But for a lot of people, I think experiences are the best thing. Working in different jobs, working in different industries, getting your hands wet, different sports, different scholastic things, whatever it may be, just getting your hands on as many experiences as possible, and then saying, you know what, I like this. This is fun. This is what I see myself doing. And then from there, maybe you go to college at like a Nassau to get your whole degree. Then when you find that one piece that you love, then go get your master's degree, and then that's your real higher education. But to spend, I don't know, these kids and these parents, they just fucking send them away to spend $100,000, $200,000. And your kid comes out and he's like, what do you do?
What am I doing?
He's a liberal arts major.
Yes.
What?
Yeah.
What'd you go away for? You could have taken YouTube classes for that shit.
I'm a history major. Like, what the
fine arts.
Yeah.
Really?
Where is that
I'm interested in painting.
Yeah. Where's that going to take? Unless you're going to get a master's and then go into teaching or something like that. But, to me, it's pretty wild. But, what you brought up before about, if you didn't do this, you wouldn't be here. And it always amazes me how life kind of puts you in the right spot, and you start thinking back and you're like, oh shit, if I didn't do that, or if I didn't meet this guy, or if I wouldn't be here, where you kind of start feeling like this is where I'm supposed to be, and you start thinking back and you're like, well, if that never happened, like if my cousin didn't come come to my house and show me that magazine, and
who knows?
I wouldn't have got.
Yeah,
maybe I would have stuck in accounting, and I wouldn't have been, helping as many people as I'm able to help because I gotten into the the field that I got into. So it's pretty pretty wild how life does that.
When I went away to school, me and my long-term girlfriend, 3.5 years, she went away to school, cheated on me within a month.
Right.
We broke up.
Right.
Devastated. Started bodybuilding.
Mm-hmm.
I literally, one of my boys was talking to one of her friends from back in the day on FaceTime a couple months ago.
Right.
And she's like, "Oh, Nick." Like, I'm like, "Hey, what's up?" She's like, I still have her back. I go, "Her back for what?"
Right.
I said, "It's like fucking 9 years ago.
Yeah.
What's wrong with you?
Let's
We're
get
still
over it."
harboring feelings."
I barely remember your name.
She's like, she's in town. She's getting married. I'm like, okay, I don't care. I said, if anything, send her a fucking thank you because of all the great experiences that not being with her has allowed me to have.
Absolutely.
I would never be working for myself, doing
Send
my
her
own
my
thing.
card. I'll shoot the wedding.
I'll send the nut butter for her future husband. I don't give a shit. Tell me what the address is.
Right.
But like, it's that aspect of it. Yeah. It's the what would happen if things were a little bit different?
Yeah.
If you got knocked off course just an inch,
Yeah.
what would happen if it was different?
Yeah,
It's
man.
crazy.
It is crazy when you start thinking about it. Yeah. I mean, I listen up every time I'm in my office and working on people and, able to change somebody's life because they've had low back pain for 8 years. And, you work on them a couple times and, the best thing, everybody's like, well, what's the best thing about, what you do? Like, and my girls ask me that all the time. Like, Dad, what do you said the best thing is watching a person walk in excruciating pain because it's all over them. It's their eyes, their aura, everything is just, and in a couple of visits, watching their whole aura change and their eyes and, the eyes tell you everything and how much pain they're in. Mm-hmm. And they come and you've just changed their whole, with a couple of little things that you did on them. And all of a sudden they're like, I said, that's the coolest thing about what I do.
And especially when they've been dealing with that forever and didn't know there was a cure.
Yes.
And then maybe one of their friends said, just go to Durlan. Just
Right.
see and try it. They leave, 4 sessions now going, holy shit.
That's it, man.
I've moved with this for eight years and
Right.
I'm good.
Yeah. And, and not to fault any other practice. One thing in our field, whether you're in health and fitness, everybody knows each other, And, the guys out on Instagram and all that. I never put a technique down. And when I get upset is when I see these other guys out there on Instagram, and I never want to mention names, but when they start putting either chiropractic down, they start putting other techniques down, and this doesn't work, and it's my way, and this is the best way, and if your practitioner doesn't do this, then get away from him. To me, that's bullshit, man. Mm-hmm. Because when I've been teaching A.R.T, active release technique, since 2000. I've been doing it since 1996. I was one of the first 15 in the United States doing A.R.T.
It's crazy.
Because the guy fixed my shoulder in like 2 freaking visits, and I was blown away. And I got into it. I remember getting back Monday to the gym, being able to bench again, and I call him up. He's from Colorado Springs, Michael Leahy, Dr. Mike Leahy. And I called him up and I said, I need to learn this. And he's like, okay, I'll be in Jersey in 6 months. I said, no. I need to learn it like yesterday. Mm-hmm. So I flew down to Colorado Springs back in 1990, got certified. And my first client was Dave Palumbo.
Oh.
He was my
crazy.
first. I used to see him in the gym all the time. And I wasn't at the gym that weekend that I went to go get certified. And when I came back, he's like, where were you? I didn't see you this weekend. And I said, I was doing this technique called A.R.T, and it's really good for like muscular injuries and stuff. And he's like, can you work on my shoulder? And started working on his shoulder, and he felt a lot better. And he's like, holy. And fucking Dave knows everyone.
That opened up doors.
Dude, when I tell you, it opened up so many doors. Next thing I know, I got Dorian walking through my door. I got Greg Kovacs walking through my door. I got Victor Martinez walk. I had all these guys. Now, you got to think. Now, I'm a bodybuilder. This is back in 1996, 1997. I was still kind of competing. So these guys to me were like, holy
idols.
Shit.
Yeah,
holy shit. This is like Greg Kovacs, who was like the biggest motherfucker I've ever seen. He was like 320 pounds, and his arms were like 20 inches, and 22 inches. And I was like, so to me, I was blown away. And these guys were getting better quick. And now you have to remember, I was the only one doing ART. So the word kind of spread really, really quick. And I was able to help these guys. Not only, the thing with me is that I had a shoulder injury, and I was getting it worked on, with physical therapy, and I had a cortisone shot, and there was no tear. I had an MRI, there was no tear. But nobody could figure it out. As soon as I went back to the gym, there's that fucking pain again. And I'm like, fuck, how am I going to get rid of this? And my buddy told me about this guy doing active release technique. Literally, the first time he worked on my shoulder for about 8 minutes, I was able to probably about 50% out of pain. And I was like, holy shit. And he explained to me how they break up the scar tissue and you get that tissue functioning normally again. And from there, it was just one person. And, you know, my thing was like, man, there's nobody doing this for bodybuilders out there. I want to be the guy because this guy fixed me. So I told Dave, I'm like, dude, send them all to me because there's no one out there doing it. Now there's you know, probably over 6,000 practitioners all over the world doing it. But I was like, you know, I want. And then Steve Weinberger called me up and he's like, hey man, I heard you're doing this technique. You know, Dorian's in town. Would you want to? Could you treat him? He's got a thing going. That's when I think he had torn his tricep, maybe, or his bicep.
Well, back toward the end of his career,
towards 96, 97, right as he was retiring.
That was the tricep at the end, I think.
Yeah, that was a tricep.
I believe so. I think the bicep was earlier, and then the tricep was later on.
Okay, so then I remember going into. Now I remember getting the call from Steve, and I love Steve. He's a great guy. And when I was competing, I always trained at his gym. And because there's no other gym like it. And I remember Steve calling me up, and when he mentioned Dorian's name, I mean, this is 6-time Mr. Olympia, right? And I'm like,
seeing stars.
Yeah.
I got off the phone. I was like, holy shit. I told my wife, fuck, I got to treat Dorian Yates. And she's like, okay. Like, to her, it was no big deal. To me, it was like,
it's excitement and it's nervousness at the same time.
Because I'm like, all right, you know, Dave Palumbo was my first, like, wow, I seen this guy in the magazines. And then, you know, I got the other guys, but now this is fucking Dorian. This is like the guy right now. So I get in and I go to Bev's and there's fucking Dorian looking huger than ever. You know, he was like close to 300 pounds and just enormous. And I work on his arm. And what had happened is his brachioradialis muscle had gotten all bound up because of how they had his arm positioned after the tear. And he's like, you know, I can't. I'm having trouble straightening out my arm. And I work on him. Same thing, couple minutes. And he's like, wow, man, that feels a lot better. He's like, you know what? I've had this issue in my hamstring. Can you work on that? I put him on the floor. I work out his hamstring and I explain to him what I'm doing, you know, and I'm just restructuring that fascia and getting that scar tissue that's formed in the adhesions and stuff.
Which is, and I don't want to stop you, but which is very important because when you have somebody that's working on you, a doctor or anything, and they're explaining the steps that they're taking to get you better and what they're currently doing to you, leaps and bounds better than somebody just pushing on you a couple times and going, all right, there's the bill.
No. I did it the same way Dr. Leahy did it on me. I explained it. In layman's term, you know, you can get into the whole fibroblast and the whole science behind it, but, you know, I'm not that kind of, I was never a big science geek, you know, just tell me what you're doing in layman's terms so I can understand it, and I'm cool. So I explained it to Dorian, and he got up, and, man, he felt better, and I was like, wow, you know, he was like, this is great stuff. He goes, you know, and then every time he would come into town, he would call me up, and I would treat him. And then one time I was treating him at Bev's, and he says, and at this point now, word was going around like, hey, Durlan's treating Dorian, you know, what's going on? And then people would, you know, is he making a comeback? This was 97, 98. So he was just kind of getting that retirement point. And everybody's like, is he making a comeback? Is he making it? So at that time, Dorian, I treat him at the gym. He's really feeling good every time I treat him. I'm working on more and more muscles and stuff. And he says, hey, you know, I could really use you in England for about a week. I'm thinking he's fucking joking. I'm like laughing. I'm like, yeah, right, yeah. He says, no, seriously. He goes, would you and your wife want to come? I'll pay for everything. Would you and your wife want to come to England? And I can, you know, you can work on me and maybe Ernie Taylor. Fuck, that's a no-brainer. It was before, you know, we didn't have any children.
My bag's already packed.
Yeah,
so
let's
go.
Tomorrow good for you?
It was in 98, and he flew us down. He put us up in this beautiful hotel. Every morning he would come, pick us up. We'd go to fucking Temple Gym. It was like a fantasy camp to me, you know, right? I'm sure it would be for all of us.
I mean, I was in Spain with him.
All right.
Yeah, I spent the week with him too.
We went there.
I'm the only one who hasn't hung out with him yet, so that's all right. You guys can hang out over there.
We would go to Temple Gym. He'd be working out with Leroy, his training partner from Blood and Guts. Dude, it was just like watching
Leroy so much.
It was like watching the fucking movie, like every day. You know,
fangirls over Leroy.
I love Leroy. He's my alarm clock. yelling at Dorian.
Oh my god!
And actually, real quick, and I want you to continue on the topic of Leroy because I didn't get to tell you this. Hysterical. I was at an appointment at an orthodontist to do photos for them, and the meter outside said 2 minutes, 30-minute parking. So I said, all right, Siri. I said, I just want to make sure she didn't go out. And I said, set an alarm for 30 minutes. Okay. Go in there. I'm talking to the people. All of a sudden, Leroy comes on.
Oh, no.
Let's get nasty! And then, like, all the women in the office were just like, what? I went, oh, my God, I really can't explain this, can I? I said, I'm sorry. I didn't realize that that's the alarm tone that it's defaulting to.
That's awesome.
Yeah, it's Leroy just screaming in the middle of an orthodontist office. Let's get nasty! Another one, yates! I'm like, oh, my God.
What a classic video that was. So I would go down to Temple, and I would hear him training with... And just watching him in person train at that point in his career was mind-blowing. And then he would take us back to the hotel. He would get in his fucking kick-ass 8-something BMW 2-door. I mean, he would have the fucking hard metal music playing to the gym. And you could tell. He wouldn't say a word. But you could tell he was getting into the fucking zone. And, like, I'm like, all right, don't talk to Dorian. He's getting in his zone. So he would just drop us off and then pick us up. And then on the way back, after his workout was over, we would, he goes, what do you guys want to do later? And we'll go out to dinner. And one thing about Dorian, man, I never put my hand in my pocket. He was like, fucking dinner's on me. I don't want
That's
you
awesome.
I'm telling you, the guy was real class.
Yeah, from what John said, he's a grade A.
Unbelievable. Yeah. So then
it was the same thing.
And then at night, we would go back to his house. And I would say, all right, what do you want me to work on? And he would say, hey, can you work on this? I'm feeling a little bit here. And I would work on that. And then Ernie came one time and, I would work on them. So every night I would work on either a different body part or same body part on Dorian. And then we're sitting down for dinner and I'm like, hey, man, I got to ask you because everybody's going to, when I get home, I'm going to be in a barrage of questions like, holy shit, you went down. I said, are you thinking about coming back? Are you going to make a comeback? And it was so cool because you know him now. He was so down to, and he's like, man, I don't need to come back. I've proven myself 6 times already. He goes, this is how much he fucking loved to train hard. He goes, I just want to be able to train hard. That's all. Mm-hmm. So all that treatment was not to get back on stage. It was just, I want to fucking train hard
Just
again.
to feel good.
That's it, man. I just want to be able to train hard. And those words like stuck in my head, and I'm like, fuck, that's what we all want. Right?
We talk about passion.
Yeah, man. That's what
that's
we all
his passion.
Want. Just fix me so I can fucking go back to the gym and train hard like I want to do,
Yeah. Back to the roots of it all.
Yeah. Just, train hard.
The same thing. When there was one of the days where we finished my back workout with him. And he said, hey, look, I ended up going out to lunch with him every single day after the workouts. Right. And he's like, look, if you want, if you're not doing anything busy, I was alone in Spain. Yeah, no, I'm pretty free. Yeah. I don't have anything booked. I'm going to work out, just hit the weights like 15, 20 minutes, and then we'll go. So I'm like, sure. So I was following him around. I'm like, what are you doing? So he's like, well, I'm inhibited doing a lot of things now because of, past injuries.
Yeah.
But he's still training hard as much as he possibly can, but not stupid.
Right.
Doing what he can. If something's bad, obviously he's not going to touch it.
Yeah.
But now he's more into the yoga, the cycling, keeping his body healthy.
Functional.
But it was crazy. I was following him around for work. I'm like, what are you doing?
It's crazy, man.
What are you doing now?
And you don't realize that, and that's why I always give, props to these guys like him, Ryan, all these Mr. Olympias. I mean, I trained legs with him the last day. Leroy had gone out of town, and he says, what are you training? And I'm like, I'm up to legs. He's like, oh, me too. So I'm like, oh, shit. And thank God out of all the body parts,
arms.
legs was my strongest point. Yeah. And I said, so he says, you want to train them. So I think I was telling you the story.
Yeah,
and I was training with him, and I said to my wife, holy shit, I'm going to train legs with fucking Dorian. So she's like, all right, well, at least you're strong down, you with legs. I'm like, yeah, no, I know, but it's fucking Dorian Yates.
She's gassing him
up.
I love it.
Yeah. So now I'm like, I'm trying to get focused, and I'm going. We start with extensions, and we go, and we're doing leg, and he's fucking pushing the shit out of me, and 2 more. And just when you think you're done, he's like, you got 2 more, and I'm like, fuck, and I'm not a yeller in the gym, like I keep my shit in. I was fucking yelling my ass off. So we done with quads. We get a little rehydration drink. We go into hamstrings. We're done. That night we're talking. He's like, yeah, man, you train pretty hard. So I'm like, oh, thanks. I said, that was great, great workout. He's like, yeah, you're probably training about 70% of your potential. I'm like, fuck me. 70%, man. I was like, I thought I was balls to the wall. And then you realize, like, all right, that's why he's there. and I'm here. That's where you got to go. And, you hear Kevin Levrone talking about, like, that mental set that you have to go into and the mental aspect that you have to go into to get to that level where they are, man, it's incredible.
You know, that was one of the biggest things I learned when I was with him in Spain was because I trained everything with him. So I trained with him 4 days in a row, which usually wouldn't do 4 days, but it was an education thing.
Right.
And you know that you have a really good workout one day, and you think, holy shit, what you used to think was 100% isn't even close to it.
Yes.
When I was with him, I learned what true 100% intensity was for my body.
Yeah.
Where I'm hitting total failure with the positives, and his theory, which is it's correct, is the positives are the weakest link and the least important.
Right.
So then he'll push through the positive with me. I'll get a squeeze and a slow negative. As soon as the squeeze ends, he'll push through, he'll squeeze, and then I'll get a slow negative. It gets to the point where if I'm doing like a Nautilus pullover like this, I'm getting that hold. Nope, it comes right back up. There's no more negative left.
Yeah, you're just like this. You're like jelly.
And that's where he wants you to get.
Yeah,
that's where he wants you to get.
It was learning a whole new pain threshold where like I thought I had a bad chest workout the other day, my first one back since you've been working on it.
Right.
But I realized it would have been a great workout from what I was used to doing.
Right.
But now that my threshold is way over here, I'm expecting so much more because I know what it's truly capable of.
Once you know,
yeah,
definitely.
it's a whole different animal.
Absolutely.
Yeah, the way that you guys are with Dorian, that was like me with Meadows when I filmed him when he was in town.
He's another great. He's another
oh
great
my
guy,
god!
man.
And then I trained with him. He's like, we could do some training. I was like, what?
Oh,
I was like, oh my god! I'm like sitting in the corner. I'm like, gotta look tough.
Focus,
Let's fucking go, kid.
Yeah.
And just
No
I
matter
had
what, don't quit.
nah, don't quit.
Don't cry.
And one tear. What are you doing, Nick? Nothing. That's what the pre-workout must have gotten in my eye. But it was sick because I had him. I have videos. He was taking videos on his story that he sent me, and he's like, "All right, come on, another one. Keep it going. Keep it going." And it's just when you get to train with somebody that you look and aspire to, and you look up to so much.
Absolutely.
I mean, I looked up. I was following John back in 2012 when I first started. I saw him. I say it all the time. I saw him doing a food shopping video with Antoine Vaillant, who he was training.
Yeah.
He was talking about all the foods in Trader Joe's, what he likes, what he doesn't like, why he doesn't like them. And I said, man, this guy really knows his shit. And so from then on, then it was like mountain dog training. What's mountain dog training? And then I so for me, I went from just like basic bitch workouts to mountain dog within like a year.
Yeah.
So I was just sprung into this world of just crazy negatives. He does a lot of ascending sets, descending. So add weight and keep going up.
Now, did you reach out to him, or how'd you guys end up?
So I guess I was just liking all of his stuff, and I'd comment, and I'd just constantly say, I love your training styles and this and that. He followed me. I screamed. I dropped my phone like a little girl. I was like, oh! And then from there, I started doing the videos. We were already talking, and I said, I still haven't met him yet. So I said, when you're in town, let me know. Met him at Natural Body event.
Oh wow!
I was like, finally, nice to meet you in person. And then he says, you know what? I'm gonna be back next month. Do you want to do my videos for the week, for the weekend that I'm there? I'm like, yeah. So then I was with him, and then from there we would talk constantly, and he gave me some of his programs that I've been doing, and just we stay in touch. He had me come to the New York Pro with him last year and film him with his athletes behind the scenes, getting ready with them, this and that. So I've become very tight with John. And
that's awesome.
When he's in town next, I want to get him on here to talk about his whole story with the intestines and all that is just absolutely insane. But I just think you talk about old school, and in a world of new school, you get a couple of outliers. Like John is that outlier. Yeah. John is that hardcore fucking dude, balls to the wall, not making excuses, grainy, and he's just cranking out there. And it gets lost in translation from when you were hitting it, Dorian was hitting it, to now.
Yeah.
You know, another one is Big Romney.
Oh.
You know what? He's pushing weight Ronnie Coleman was pushing.
Right.
But Romney's keeping his mouth shut. You know what I mean? Ronnie was screaming all day. That's why there was so much attention on him. But Ronnie was, but Romney's just out there in the Middle East.
He makes you look effortless too.
Being quiet, and he's enormous.
I've never seen him in person.
Oh, I've seen him.
Is he huge?
That
all right,
story.
let's hear the Audi story.
Very, very quickly, because we've said it. We said it a couple times, but Steve asked me to go pick up Rami from the airport years ago.
Oh wow!
I was, bodybuilding fan like you.
Yeah,
I was
absolutely.
Like, Rami? I said, damn, it's done. And then I get off the phone with him. I'm like, fuck, I don't think he's gonna fit. I'm like looking, it's the off season.
Why? What kind of car do you have?
I have an Audi S5 2-door.
Oh,
I'm like, shit, I don't think he's gonna fit.
Tie him up like a Christmas tree.
Right.
Yeah. So I pull up to the airport, nicest guy in the world.
Right.
The nicest guy in the world. Pull him up. I'm just like, hey man, coming to pick you up. Blah blah blah. He's like, okay. We're walking to the parking lot. And I keep looking at him. He keeps looking at me. I keep looking at him. And it's just like, I said, he's like, almost like what?
Why are you
Like,
looking
like
at
what,
it?
what's
Yeah.
up? And I said, hey, man, I got to be real with you. I don't think you're going to fit. So he's like, don't worry, we figured it out. I'm like, okay. And he gets into the car and,
Did he barely fit?
well, I drive stick. So every time I shifted into sixth gear, he had to move his thigh. But other than that, you felt the car push down a little bit on his side.
All right.
I mean, it's low. My car's low, and it's never had a water buffalo in it before. But sweetest guy in the world. Like
what amazes me about his physique is the clavicles. His shoulders are so, when you see these guys that are wide, the first guy that was like that to me that I saw was Johnny Moya. You guys know Johnny Moya?
Yeah, yeah.
I've heard the name. I've probably seen him in like a picture
guy,
of him.
small guy, but he's got wide fucking shoulders.
And
'cause
just
they're
perfectly rounded too.
Yes, their clavicles are so far apart, and that to me, Romney's like that. He
Yeah.
just has that crazy. So he looks so impressive, even though his waist might be a little bit because he's such a big guy and he's got the big legs. His shoulders are so wide that he gives that illusion of that X factor.
But that's what it's all about. It's about that ratio.
Yeah.
Where if that waist to taper ratio, you could have a 3-foot waist, but if you're 6 feet out, kind of who cares?
Who cares, right? Because as long as you're giving that effect look,
How do you spell the Moya last name?
Moya. He's not competing anymore, but
Yeah, he's
he's a
not.
good guy.
Yeah, people, not that they underestimate Rami, but he doesn't get the credibility he deserves.
He looks great. I think he looks great.
He looks insane.
Yeah.
Is he fully healed up now?
I think he's good.
Is
Yeah.
he?
Yeah, I
Because
think
I know
he's
he was
good.
battling a shit ton of injuries last year.
Did he have surgery? No.
I don't think
Yeah,
so.
surgery.
I think
It's funny though how life, like you were saying before, like certain things, like how'd you meet that, John, and you're like, well, I was just kind of following him,
I was
and
following his program.
it's funny how
Yeah.
just you start, I'm gonna go back to what I was telling you before with Triple H, and I remember watching. My boys were like uber into wrestling, when they were smaller, and they still are, and we were watching wrestling on TV, and I'm like, oh, this is another avenue I'd like to take. As I treated all the bodybuilders, and I see these guys wrestling, and I'm like, I'd like to get into that.
Yeah, and how many injuries they
treating-
probably
Yeah.
have.
treating them, and getting them back into working order and stuff like that. And again, going back to Dave Palumbo, and it's so funny because not meeting, if I hadn't met or become friends with Dave, a lot of these opportunities in my life, like Dorian, that probably would have never happened. And Triple H was another one who's a great guy, him and Stephanie. And I met Triple H at backstage at a wrestling event Dave took me to. And I said, hey, man, my boys are really into wrestling. I know because he does their diet and stuff. And I said, I know you work, is there any way you can get tickets? So he says, yeah. He goes, I'll get you backstage and, you can meet him and stuff. And we went to the show. It was at Nassau Coliseum, and we go back, and my boys are like, all their action figures are like coming to life in front of them. They're like, oh my God, the look on their face, like when they first go to Walt Disney, And I remember meeting him, and Dave was like, hey man, you gotta get some ART done. Durlan's the guy, and you gotta come. But I knew he was in Connecticut, so I said, listen, I'll hook you. I can hook you up with somebody down there, and maybe we could do that. And so they called me back up. Dave was like, hey, do you know anybody in Connecticut that does ART? And I look a couple of people up, and I see one guy that I know is familiar. I call him up and I said, listen, I'm going to hook you up with, Triple H. So he says, oh yeah, I know him. So I said, I'm going to hook you up with Triple H, and I'm going to give his assistant your number, and they're probably going to call you and blah, blah, blah. A year goes by. They're back at the Coliseum, and I asked Dave again, hey Dave, I hate to bother you. No, I'll get you tickets. We'll go backstage. We'll say hi again. Same thing. So I go to him and said, hey man, how'd everything work out with that guy? He says, no, I never got to meet him. So I'm like, well, what do you mean? He goes, no, he wouldn't come to my house.
Ugh.
He goes, he would make me, and with their schedule so crazy, they're
Small
constantly
window.
traveling.
Yeah.
Small, to me, it's like if you don't take an opportunity. So I apologize. I said, listen, dude,
You got to bend.
I'm sorry. I said, listen, if you need anything, I'd be more willing to, more than willing to treat you if you needed it. And Dave was like, well, he's the guy you want anyway. He taught all these other guys. And so Dave is like my best PR guy.
The hype man.
Yeah.
We got to send Dave the check.
Yeah. So they ended up, a couple of months later, they ended up calling me back. And they said, hey, could you come down and treat right after he had fought Brock Lesnar at WrestleMania. He got a little banged up. And he says, can you come down and treat him? And I said, yeah, I would love to. And went down. Talk about a bodybuilding fan, man.
Oh yeah.
He is the ultimate bodybuilding fan. He knows. He used to be a body. When he was younger, he competed and grew up in the gym just like we did, and lifting weights with the bigger guys and admiring Dorian and all these guys, and we shot. My wife. I came home that first night after I treated him. She's like, "Holy shit! How long were you there?" I'm like, "Dude, we were like talking for like almost an hour." Just like I said, he's the coolest guy. He's like straight edge, no drinking, no smoking, loves his lifting, and he's a big bodybuilding fan, and we just started, clicking, and we started talking and stuff like that. And, 9 years later, I'm still, going down there and working with him. And I've been able, thank God, to work with, the WWE and work on some of the guys using some A.R.T, which is when he started feeling the results of it, he asked me, he's like, man, could you work on a couple of the guys that, might need your help? I think this technique is really, really good, And I said, well, I would love to, and that's how that whole relationship. But he's a big bodybuilding fan.
That's awesome.
Yeah, that's crazy.
He's awesome.
How often do you still see him?
Once a week.
Oh, really?
Oh, no kidding.
Yeah. Once a week we get together, and I'll treat him, and I'll treat Stephanie, who's a sweetheart too. They're the nicest people you ever want to meet, man. They're very very caring, very giving, and we'll take the shirt off their back for you. And
the kind of people you want to associate with. Yeah.
It's funny, and just on a side note, because I've treated some pretty famous people and some football players, and sometimes you don't know how money's going to affect people, and I've gone to their houses and stuff, and man, they treat you like you're
they treat like you're a servant, like you're there to
that's
just
a perfect word,
like you're there to serve them and then leave.
I'm not, and I remember the first time I was going to treat Paul. I said to my wife, I said, listen, I'm going to try it, but I don't know if it's going to work out, because I've done this before. I've done the whole house visit, let me treat you and stuff like that, and then just been treated like a servant.
Yeah.
And I'm not into that. I'm going in there to help you out. I want to share my knowledge with you.
Respect is a two-way street.
Yeah.
Exactly.
It's still business, but
right.
Respect me.
And let me tell you that I went to their house, and he was the coolest guy. And I came back to my wife. I'm like, fuck, I would do that 5 days a week, because it's just like sitting down talking with you guys. We're just shooting the shit,
That's
just
it.
talking like
That's it, man.
three regular guys and just hanging out. And that's how it is. Every time I go to his house, he's like, hey, man, what's up? Hey, did you see that? Did you see that picture of Romney? I'm like, hey, he looks fucking insane, right? And it'll just be like a bodybuilding talk. People are like, oh, what are you talking? I'm like, man, we just talk about
you're friendly in your guys.
Yeah, like the last thing he wants to hear about is like fucking, they ask him
so
about
good at that
wrestling
last
and
fight.
stuff
Yeah,
like that.
well.
Yeah, I'm like, well, I don't want to. So we'll start. We talk about Kai all the time. He's another freak.
It's funny.
Is
You
he
guys are talking
coming
about
back or no?
first.
Oh,
Don't look at me. I don't know. I don't know him or anything he does.
He was one of the first bodybuilders I ever saw. Where
who, Kai?
Kai, yeah. I never saw before I saw him in person. I mean, somebody showed me his Instagram. You ever hear Kai? I was like 16 at the time, and I was like writing down on my workouts.
That was a year ago.
That was last year, yeah. And he's like, "You ever hear Kai Green?" I go, "No, who is he?" Shows me a picture of the guy. I go, "What the fuck?"
Oh my god.
This was, I guess, back in 2012 or so.
Okay.
So a bit ago.
Right.
But Kai wasn't nearly the size he is now.
But
when I saw him, I go, "What the fuck is that?"
We were we went to talk about Triple H. He's a big bodybuilding fan, and he was going to go down to check out the Arnold, and he's like, "Hey, you want to come?" Fuck yeah, I'll go to the fucking Arnold. So we go there, and we were able to go. That's the year that Kai won. And
Okay.
we went backstage, and jeez, I mean, he's really like a specimen, especially like in shape and stuff. I mean, I've seen him in the gym, and he's tremendous, but when you see him backstage, and he's in shape,
ready.
yeah,
Peaked,
and you just see how dense his muscle is, and how carved out his his abs are, and you're like, geez, we took a picture with him. I was like, wow, man, I'm a big big fan, and he was very very cool, very soft spoken, and but you really appreciate when you're up close like that, backstage on these guys, and when they're in top shape, you're like, wow, that's a lot of work, man.
Yeah, ever since I did videos with him, everyone asks me, he's coming back? I'm just like, well, first off, I can't talk about it if he is.
Yeah.
I said, second off, I said, all I can say is, whether he is or he isn't, he has not stopped training hard.
No,
because he loves it.
Yeah. My God.
Because he fucking loves it.
Going back to Dorian, right?
Yeah,
he wanted to get treated. Why? No, not to I've already won it 6 times. Look, Kai's proven himself over and over, right? He's won the Arnold.
Should have won the Olympia.
Should have won the Olympia. Came in
Multiple
second that
times.
year, yeah. And so he's proven himself. But fucking guy loves to train. Right?
Yeah.
Which is
you come back to the passion.
Right.
What do you love to do?
Yeah,
he loves to train. And and the one thing I say to everybody, you know, everyone asks me, who's your favorite person you've worked with? Who's this? Who's that? You know, Kai is easily one of them. And it's not just because of the name. Seriously.
Yeah.
He's just, there's people that I've filmed for that I turn the camera off and they're completely different people. Instagram, social media is off and they're completely different people. I've never had that experience with Kai.
Wow.
He is through and through.
What you see is what you get.
Good dude.
Yeah.
Like you see how he is on his Instagram? That's how he is.
Wow.
Anytime I filmed him, hey Nick, can I get you a meal? Can I get you something? What do you need? What do you need?
That's great.
I'm like, I don't need anything, man. I'm good. I'm here to film you.
Right.
Like you're the homie. I'm here to film you doing your thing.
That's
Don't worry about me. I'm sorry it's taking so. Yo,
Right.
you think it's my first bodybuilder I work with?
Yeah,
Listen, I get extended training sessions. It's cool.
Right.
Yeah,
Train.
yeah.
I'm
It
here
happens.
for you. Train.
That's
Whatever you
awesome.
want to do, man.
That's
so,
great.
and I went to the Arnold with him last year.
Okay.
It was a great experience. Just lot going on.
Yeah.
Lot going on. He had the
Right.
comic book. He was running
Yeah,
around doing
yeah,
a million and one things. And then it's hard as a videographer to capture all of that and then edit it all that night and have it up and ready to go at midnight that night.
Oh, so you're almost doing like a documentary with
So here's how I explain it. So when I go to a show with an athlete or I go to a show with a company, essentially what they ask videographers to do, and it's not fair in all aspects, and it's not just Kai, it's not just it's everybody.
Right.
What they ask of videographers to do is to shoot all day at an expo, shoot all interactions, anything like that, go back to the room and edit. And they want you to get them a copy that night. And it's it's a lot of work. People don't realize how much work that is because let's say I film for 2 hours, like total filming. I have 2 hours of film on my memory card. Now I have to scroll through 2 hours of footage to find all those pieces, get a song that matches it, put it all together, make it interesting, chop it up for Instagram, chop it up for Facebook because it's different sizing and aspect ratios, and then get it ready for all platforms and send it out. If there's talking, I have to type all the text out, align it, make it all up. It's a lot of work, and people don't realize it.
Not to mention those export times.
Yeah. I mean, if you don't have a
We
fast,
fucking know about that.
yeah, he was. So John's been helping me with some of the videos because it's hard for me when we first started the podcast because I was super busy.
Right.
Still am. It's just different busy now. Now it's like a lot of meetings and running around scheduling things. I would have him do the videos because we record right there, one camera, and I would have him help with that export and help with the clips too. And then I basically showed him how we have to foundationally make the clips, and now he's good. He knows what he's got to do. But like even still, to meticulously put everything in, this and that, he's realizing how much effort everything takes. How a small change could be 20 to 30 minutes now.
Yeah.
And it's not like people hear, 1 minute video, whatever. That 1 minute video could be hours of editing. So what I'm seeing is a lot of people are, because there's a lot of young kids with cameras, and I was one of them. I was a young kid with a camera. Like I bought a camera, I started doing my thing, and now look where we are. Right. So the hard part is combining jobs. Right. Whereas you would normally back 10 years ago, 15 years ago, you'd have a shooter, an editor. The editor would not be burned out from shooting all day. Right. But now, because they're able to combine both, because shooters know how to edit, now you have a guy that's been working since 7 a.m. Right. He gets back to the hotel room at 7 p.m. and he doesn't finish working until 1 a.m. To get you that edit of a recap of an expo day. Right. It's a lot of fucking work, man.
It is a lot of work.
And it burn. Once again, we talk about what do you see me with every week, every month now? Yeah. You see me with super tight. What are they called?
Yeah. Suboccipitals.
Yeah, and you see it a lot with kids that are looking down at their phones, computers. I catch myself all the time. I'm tense. Yeah. Even now, like sitting here, like every now and then I'll feel my shoulders rising. I'm like wow, fucking relax.
Like, you're ready to jump over the table.
Or I'll feel my head start to crane forward.
Yes,
and I'm trying to pull it back.
That's the thing.
But now, hours of shooting like this, like this, and then hours of editing like this. And we wonder why you start getting tension headaches and I'm getting vertigo and shit like that. So it all compiles and compounds, and it gets a little crazy after a while.
Yeah, but the quality of work you're putting out is really good, man.
Thank you. Yeah. Little by little, I'm getting where I need to be.
Yeah, definitely, man.
I'm slowly getting to a comfortable place, and like I said, I've transitioned. I tell a lot of people I've transitioned lately from working with bodybuilders and working with amateur athletes to working with businesses.
Yeah.
I want to tell stories. I don't want to just like shoot the same shit.
Yeah,
I don't want to shoot the same bicep curl over and over again.
Right.
It's fun. It's fun the first 4 times. Exactly. It's fun the first 4 times, but then you realize how much longer can I do this? The same song choice, the same edit, the same doesn't do anything.
Right.
And I've gotten on a point of wanting to pump out quality content. What type of content really makes a difference in people's lives? I sent John a video last night of this girl, pretty girl. I've seen her from years ago when she had like barely any followers. She's from Florida and now she's in LA.
Competitor or no?
No,
just a pretty girl.
Just a random fitness girl.
Right,
okay?
right.
And she's literally just like, she walks out of the salon and she's like this. Over and over again. Like this for like 30 seconds straight. And I sent John, I go, what the fuck is she doing? I'm like, 110,000 views. Wow. And what bothers me is Gareth last week talking about working with kids with cerebral palsy and special needs kids. That barely gets 500. The skewed perspective of what we actually pay attention to is so fucked in the world.
It is.
And the older I get, the more outspoken and bothered by it I am. I'm so bothered that heartfelt, real stories of people helping people.
Right.
We're all just trying to do our best on this big blue marble, right?
Right.
You're trying to do your best.
Absolutely.
John's trying to do his best. I'm trying to do my best.
Yeah.
And yeah, you know, let's say we don't know each other and we run into each other on a bad day and we have a shitty experience with each other or a shitty interaction.
Right.
It sucks. But you know what? I always try to backpedal and say, listen, we're all trying to do our best. Something must have happened, throwing them off, whatever.
Yeah.
But like, where do we draw the line that that's the type of content that's getting that many more views? Is it just a bunch of horny guys watching?
Yes.
I don't understand.
Yes, it is.
Probably.
Yeah.
I don't,
But you know what it is? It's the younger generation too. I mean, I see my kids just scrolling through the phone sometimes. Like, what are you looking at?
Yeah. What are you looking for?
Is it anything that's going to help you? And I'll grab my boy's phone and I'm like, you know, they're both baseball players, and I'm like, let me see. I want to see is it going to help you? They're watching like a fucking Fortnite video. I'm like,
yeah.
That's what I was about to bring up. You have kids that are too lazy to play video games nowadays, and they're watching people play video games.
They're watching videos of people, and it was like, it was like, I mean, they don't do it as much now anymore, but now they're just watching like silly videos and laughing and shit. But it was like from like ages of like 10, 11, 12, when Fortnite was exploding.
Yeah.
They were playing Fortnite, and then they were watching Fortnite on the video on their phone. I'm like, guys, it's
nonstop.
Yeah, thank God they broke out of it, because I was really starting to get a little worried. I'm like, this is not good for them, you know, like to do so much. And we'll always push them. Like, you know, my boys they've been working out since they're 11. I bring them downstairs in my basement. I'm like, listen, we got to work out. Let's get you away from that TV. And I think it's important, you know. And we have a gym set up now in our once I stop competing, we put a gym in our basement. You know, my wife works out there. I work out there. My girls have worked out there. And, you know, I think it's important because kids do what their parents, you know, kids do what they see, right? Not what you tell them. You could tell them, you know, 100 times to do something, but if they're seeing you sitting on the fucking couch on your phone, guess what they're going to do? They're going to sit on the couch, watch their fucking phone, right? But if they see you working out, they see you doing some stuff, healthy stuff, you know, fitness stuff, they're going to be like, wow, you know, my mom and dad do that. So I guess that's the right thing to do, right? Because they look up to us, right? They're mirror images. So they're going to say like, well, if it's good enough for mom or it's good enough for dad, it's got to be good enough for me.
Yeah.
So if dad is sitting on the couch just fucking hanging out, looking at his phone and not doing anything, guess what I'm going to do? I'm going to do similar stuff, you know? So I think that's important too. But it's, you know, that younger generation it scares me a little bit.
It's weird. It's very weird culture. It's.
But now I heard that even at the gym, like I haven't trained at a gym in a long. If I go away, I'll go to a gym. But somebody's telling me that all these kids are just like they're just filming themselves. Is that how it is now?
Yeah.
I haven't gone.
I've been guilty of it. I won't sit here and say like I'm a priest, like I'm you know, like I'm the better than everybody, holier than thou. Like, I'm not. I've been guilty of it in the past, and luckily mentally, like you said with your boys, I broke out of it.
Yeah.
I realized that this is fucking stupid. This is dumb. What am I doing?
If you're gonna take pictures of yourself and videos because you're trying to build a brand and you have a well thought out process, you know what? Go for it. Doesn't matter if you're a 13-year-old kid that's 150 pounds. You don't realize that. You're not somebody needs to follow yet.
Yeah.
Or you're an IFBB pro. If you truly believe you're doing this to help other people, to build a brand, whether it's selfish or not, but it's for business, you know what? Fucking go ahead, go for it.
Yeah.
But if you're doing it just for your ego to show your friends and post on social media going, look at me in a string or I'm jacked.
Right.
I have abs.
Give some pertinent info. Give
course.
something that's going to help people. Trainers like the trainers and stuff like that.
Yeah.
Hell, I'll follow them all the time because I'm like, oh wow, listen, John might do something at the gym, and I'm like, well, shit, I didn't know that. Or he might do an exercise, or you might do an exercise. I'm like, wow, Athlete X. I follow that guy, and he's a PT, and he gives a lot of training advice and stuff. And the guy's in great shape, but sometimes he'll do an exercise. I'm like, wow, but these kids are just like post stuff just because they look good in a tank top.
Yes, and
when
looking good in a tank top is
filters,
subjective.
They look good in a tank top.
Yeah, well, I mean, when I was young, I was never in a tank top in the gym. Even when I was competing, I was always covered up.
And you were at Bev's too.
Yeah.
And now think
oh
about
my God,
now
I would never.
Well, I want to think about it like this. I actually have a video I got to show you. This is like 2 years ago. There were these young kids there.
At Bev's?
Young kids, like 15, 16 years old, probably, maybe 17.
It's different since you've been there last.
Oh, it's very different. Okay, it's a destination now. Okay, wait, it's gonna get great. And they took their shirts off. I'm talking like skin and bones. All right, and I'm not just trying to be an asshole. I'm just saying skin and bones. Okay, and they're like leaning on each other like this, taking pictures right by the mirror. And I take a video of them, and I pan, and Max Charles is sitting on the bench, and he's like this. He's just shaking his head. I was like,
Max probably covered up, right?
Totally covered up. And you can still see how big he is.
Right. The guy who shouldn't be covered up is covered up, and you got the other three.
That's the thing. The higher of a class of an athlete you are, the more layers you're wearing.
Yeah.
Why? Because you don't have to show off anything.
Right. I tell my boys that all the time. When they're playing their baseball and stuff like that, I said, listen, the Ferrari never needs to rev his motor, right? Because everybody knows how fast it is. As soon as they see it, they know how fast it is.
Yeah.
It's the little guy in his Pinto. He's got to make all the noise.
79 Pinto.
Right.
Exploding.
He's got to make all the noise. When you like you said, when you're a high level athlete, you don't need to make all that noise.
Yeah.
Man. You just prove it on the field, or you prove it on the gym, or you prove it on the stage.
And also, where's your ego? You can't be that big in a gym with Max Charles and Juan, larger people, and think I'm the alpha here.
I took my shirt off.
In what world?
I took my shirt off once in the gym. Once. It was at Montanari Bros. I felt super awkward. I was pre-contest.
Yeah.
Alpha Design. I was training with, do you remember the black dude? Oh, God, what was his name? Jeff Logues.
Oh, yeah.
All the tattoos. He used to train with Centopani.
Right.
Him and I became super tight. Right. So when I was away at school, I trained with him.
What's going on with Centopani?
I have no idea. I filmed him in Meadows.
He was a monster, too.
Wait.
Yeah.
No. I filmed him in Meadows. When was it? When was I up there? August.
Yeah.
Filmed him in Meadows in August. They trained legs together. Evan said he was coming back next year.
Oh, wow.
Yeah, he said he was feeling good from his knee.
Yeah, that's cool.
Evan was another great dude.
Yeah.
But so literally the shirt that
stripped down and
the shirt that Jeff was wearing wasn't like good enough for the pictures, and Jimmy said, "Can he use your tank?" My tank top. I'm like, my tank top? He's like 5 times the size of me.
Oh, that's why you took off your...
That's why.
I took my shirt off, and I'm standing there like this. I'm like, oh, this is weird. I wouldn't even take it off in the locker room.
I wish I had a pump right now.
Oh, my God. Why is it so cold in here?
I'm playing on the other side of the camera.
There is no veins in here. But I don't. It's interesting to see the culture, how it's changing, and it's always changing.
Yeah.
And every episode we talk about social media. It's so prevalent. It's so important in everyone's lives.
It's part of everybody's life now.
Exactly. Not only business wise, but just in general. My standpoint, like I said, I wish that the good messages were the ones. They don't make news stories. Right. They don't make headlines. I don't watch news. I don't watch any of the news.
Stay away from the news.
Stay away from it now. Because that's all they talk about is bad, negative. I don't let my kids watch it.
Fuck the Democrats, fuck the Republicans. I don't care. It doesn't matter to me.
And
what you view doesn't matter to me. I don't care. Right. You can enjoy. You can like whoever you like.
Right.
Just be a good person. That's all I ask.
Yeah.
And it's so negative constantly because negativity breeds controversy.
Right.
And then everyone's they're mad about everything and they want to send it out to all the people.
But don't
fuck
you
this
think
person.
that's why the world is so I'm a big law of attraction guy.
Yes.
I like law of attraction, and to me it's like you keep pumping that negative thoughts into people, they keep pumping more negative, and I think that's why half the time the world's all fucked up sometimes.
Absolutely.
It's like there's a lot of weird people out there. Like I will not let my kids, because I'll put on the news in the morning, have my coffee before we go work out downstairs with my wife, and then just to get the weather, see what the weather is like. And you have to listen about who got shot, who got stabbed, who's this. I'm like, fuck. Like, you're not even up yet, and you're getting bombarded with all this negative. You don't even feel like going outside. Like, holy shit, if I go outside, am I going to get, somebody going to drop on my head? Am I going to get stabbed? So that's why my kids will not will not watch.
I tell my mom. My mom watches the news for the weather and everything like that too. I say, just go on the app on your phone.
I know.
We cut the middleman out.
Yeah.
Dark sky, send the check. Dark sky, phenomenal. I mean, I love it.
Yeah.
It just boom.
I got to get that.
What's the weather? Hey, there we go.
Right.
Great, done.
That's
I don't
it.
need to see anything.
Yeah.
But my mom talked about recently, which was a great point. My mom talked about how much negativity we see, how much shooting and violence and this and that we see, and I said, it's always been there. Don't be fooled thinking that this is just happening now. No. Now everyone's got a camera. Right. Now everyone has a social platform.
Yep.
Now you hear about it because something happens.
Yeah.
Done. It's out on the internet within minutes.
And then what's the biggest clickbait title you can give it?
Tell me.
Ooh. All right.
Tell me.
Somebody stubs their toe on an anthill.
Yeah, it's just like
local man destroys colony events.
It's just ridiculous.
Yeah.
I mean,
and they're all your hits, right? You get all the hits.
That's how you get all hits.
Exactly. Like,
or if we want to clickbait your podcast right now,
right.
Durlan Castro says what about Dorian Yates? And then, but then it's all good stuff.
Yeah.
And then people are like watch the video, and then they're like, "What?"
Right.
But now you get the views.
Yeah.
It's bullshit.
Yeah.
It's bullshit that's what it takes to do things now in today's times to stand out.
Mm-hmm.
Your content should just stand out.
Right.
The good-heartedness of the people that we have on, the stories, the interactions, the ups, the downs, everything that people have fought for should just stand out and make people inspired to be the best version and nice of who they are.
It's funny, I should stop. I'm on Instagram, Dr. Durlan Castro, also Durlan Castro. And people are like, oh, you should post more. Most of the stuff on there is my boys playing baseball or my girls at graduation or something like that. People are like, you should post treatments. Yeah. I've thought of it, and I'm going to be honest with you guys. I said, there's so much, because if I go on there to look at other practitioners, there's so much like bullshit on there about people that are getting critiqued. So now, if I go on and say I post a video of me treating John with shoulder or your neck, and I explain it, there's got to be some idiot who's going to come on there. Well, this is not true, and this is not
1,000%.
Yep.
You know what they're called? They're called keyboard warriors. They're
that
people
what
that are they're people sitting on their phone typing out hateful messages at everybody because they think that they're a professional in all aspects of life, when realistically they've never treated anybody.
Right.
They've never done anything.
Right.
I literally posted this with Steve Lorius.
Yeah.
right.
People, what I say with Steve could win the Olympia 10 years in a row, and people will say, "Oh, fuck him, he didn't deserve it."
Yeah.
There's always somebody that's going to critique you negatively, and
Right.
it's unfortunately, like I said, social platforms. It gives people a platform. It makes people think that they're important. Just because you can say things to other people doesn't mean
Right.
you're fucking important.
And it's tough to ignore. And it's funny because with Triple H, they're big social media, and he posts off all the time. And I'm like, well, how do you? And I asked him that question. He goes, I don't look.
Yeah.
I never
post it,
look.
post it, and,
Yeah,
and
post
look,
it
and,
and try
and
to
don't look.
Exactly what he does. So maybe I'll start doing that.
But for you too, it's you're busy using both your hands to fix somebody.
Right.
Not one hand and one holding the camera and trying to explain it. You know you're going to do a better job just going in there and working on it. You know?
Yeah. So maybe I'll start.
Yeah.
I'll start
We
posting.
should start. We should
Yeah,
talk.
it never
I'll,
hurts.
I'll hook you up with some stuff, man. We'll do some
exactly.
cool stuff.
Yeah, because if I could, listen, if there's somebody suffering from headaches out there and has been getting the Botox shots and this and all that stuff, and it's not working, and I'm not saying that stuff doesn't work. Like, I have people coming into me that have been suffering with lower back pain for 8-9 years, and they've had the whole thing. They've had the epidural, they've had the anti-inflammatories, the meds, the painkillers, and nothing's working. And then we hit their hip flexor, we clear out their hip flexor, we clear out their glutes, we give them a couple little stretches to do, and holy shit, they're a lot better. To me, that's if I can help somebody find that, like, wow, this is what worked for me. And again, I'm not saying like, listen, sometimes people come in to see me first, and after 3 or 5 visits, if you're not like, hey doc, I'm feeling a lot better, I'm sending you out. I'm either going to get you an MRI, I'm going to send you to an orthopedic because I can't fix it. Nothing gets me crazier than when I hear people come in, oh, I've been going to the, and again, I'm not doing it to knock down a profession or this or that, but I've been going to so-and-so or this type of like a PT or an orthopedic for, 6 months. And I'm like, why? If you're not getting better, like, I don't want to tell you, if you come in to see me, I could fix you. And after 6 weeks, 7 weeks, you're still coming in. You're like, fuck, doc, I'm still feeling that. I'm not going to keep treating you. I'm going to say, okay, well, you know what? The technique that I do is not going to fix you, but this could fix you. And that's another thing. there's a lot of techniques out there, and they're all great, but they don't all work for a certain condition. So, but I do the active release technique. That's what I do. When I learned it, I said to myself, I'm going to be the best A.R.T. practitioner. I'm not going to do A.R.T., M.A.T., this, that. I'm not going to do everything because I don't feel like that does justice to me. I want to learn one technique, and I want to learn it the best I could. And if that's going to help you with your shoulder, if that's going to help you with your, then great. If it's not, I'm going to say, hey, listen, it's not working. You got to go somewhere else. Or I can direct you. You know what? This might work. Or let's get an MRI. Maybe it's something. And usually when I get an MRI, it's usually a tear, a really bad herniated disc, or a fracture, or something like that. That's why it's not working.
Yeah, it's somewhere you need a little bit more of a natural solution.
Yeah.
But ART should be the first thing to go to, because before you start taking Botox shots and epidurals, you know what? How about let me see if I can dig in there and fix the problem and let your body do what it's supposed to do and heal it up.
Not just put a Band-Aid on it. You know, a lot of these times these painkillers, and I'm not saying, again, sometimes you don't need it. There's times that patients come in and I can't even touch them because they're in so much pain. I tell them, listen, go to the ortho, get some pain meds, 3 days, come back. And then we could fix what the cause is.
The root.
Right. The causes. We're not just going to put a Band-Aid and say, oh, good, you feel better because you're numb. And now, 6 months later, you're back, with the same thing.
I've gone to chiropractors in the past, and they've definitely milked it. And that's what my grandfather used to say.
It's such a
he used to say, they're milking you, and this and that. And because I would go to him, and it'd be this full, listen, when I go to your office, whether I have a problem or not, I go to you for maintenance now once a month.
Right.
So whether I have something or not, you're in the office, you do what you have to do, and you're out. There's no hour session of you just doing your thing.
And that's another thing that I don't feel like time is quality sometimes. That we had a patient a couple of months ago who came in, a new patient. He was an athlete, and came in, and then my secretary was telling me, when so and so came out, he was like, oh, he only spent like 10 minutes on me or 8 minutes on me. And her first question was, how do you feel? Well, I feel better. Okay.
There you go.
Why do I need to spend an hour on you?
You don't.
Because you're paying for my knowledge, right? And there's a lot of great practitioners out there. If you're paying for my knowledge, if I can fix you in 8 to 10 minutes, just because I spend an hour on you doesn't mean my treatment is any better. I might need to, if I have a private patient that I need to spend an hour on because he's got multiple, like Triple H or Dorian, when I only see them very, very few times. Yeah. If I need to spend an hour with you or 45 minutes on you because I need to do different type of the muscles and stuff like that, then I will. But, usually in the office, it's anywhere from 8 to 15 minutes. But I'm honing in on what the problem is.
If you're usually coming in with one problem, where it won't take 45 minutes for one tendon. Yep.
But sometimes there's fascial chains where certain muscles are attached to other ones, and I'll have to work. Say a hamstring comes in, I might have to work all the way up into your back because that fascial chain, everything kind of connects, and I need to work that back out. So I'll need to spend a little bit of extra time. And there's some patients that come in, man, I might be in there for 15, 20 minutes at a time.
Wait, everything in the body's connected? That's weird. That's so weird. I thought everything would just have its own quadrants. I was getting severe pulling every time I would do a press, like needle pain between my front delt and my shoulder and my chest wound up being my lat.
Yeah.
So you never know. I mean, you have to get in there, feel around, see what's going on. Absolutely. Then once you assess what actually is the problem, you can then go dive in fully.
Yeah, that's another thing to practitioners out there who you can't keep beating a dead horse. My thing is when a patient comes in, listen, we're all dollar conscious now. So if a patient comes in and I accept one insurance, that's it. The rest is cash pay. So I know that in your mind you're thinking, how much is this going to cost me? I know I feel like shit. How much is it going to cost me? So, if I tell you, listen, I'm going to try to get you better in 3 to 5 visits. If you're not, then I'm going to send you out. In your head, you're like, okay, you know what? For that, maybe I'll feel better. I could do that. But I don't want to tell you, and there's some chiros out there who do it. I don't want to tell you, well, it's going to take you 34 visits, and you're going to prepay, and you're going to do. And there's still guys that do that, man. I'm like. And that's another. I never want to be in control of your health, John. When your shoulder hurts, you're gonna come in to see me.
Right.
I don't need to send you fucking reminders, phone calls, and bullshit. I don't need to do that. There's enough patients coming through our door, thank God, And I think that's the reason why is because I don't take that measure. I let you when you have a headache and you don't feel like you pop in. If you want to, I never tell the patient, hey, come in, this many times or come in every month. It's usually the patient like yourself, Nick, who said, you know what? I want to come in every month. I want to get some maintenance care.
Yeah.
Okay, great.
It's been years I've been neglecting myself, and now it's time. And I knew
people want to come into your business.
Right.
Not because you're harassing them.
But you were also the one that recommended one time. You could have said, come in two times a month, every other week, other week. And I would have believed you.
Yeah.
But realistically, you kept it real with me.
I can't do that, man. And
I can't either. I don't have that bullshit gene in my body.
That brings it back to what we were talking about with social media. You're providing a quality service that, you know what? It's hard to get that out to the masses.
Yeah.
But rather than somebody else where the sexy sell is, oh, you're going to come in 3 times a week, and they think, wow, I'm getting all this attention. You're getting your time wasted and your wallet drained, but sure, if that's what you think is good.
Right.
But wait until you speak to somebody with more knowledge.
Yes.
And see what really comes out of their mouth. You know?
Absolutely.
Yeah, it's weird. It's crazy to see how many people like take advantage, manipulate. Can I ask you guys a question? It's like a little side question. Is it just me, or does like 90% of the females like on Instagram and stuff like that, do they look like they're all going to the same plastic surgeon now? Have you seen that? They all look the same.
Yeah, I'm married, so I don't.
Oh, you're not.
Is
it just me, or are they all getting the same lip face thing? And I feel like every plastic surgeon's just milking it now. They're all
they are, and then Instagram filters take over.
Well, Facetune takes over.
We've had, we've gone to gatherings and stuff where we've seen, friends, and you're like, holy fuck, what are they doing to their faces?
It's weird.
Yeah.
The women, with the lip thing and the whole, and you're like, what?
But if you know now, you're gonna notice if you start going to some of the gyms.
Yeah.
Like not saying because you're not saying because you're looking like that, but you're gonna notice.
Oh yeah.
Everyone looks the same now.
I remember. I think it was a Joe Rogan podcast. They were talking about getting a lot of plastic surgery done and stuff, and how eventually how botched it looks. Like if you're 50 trying to look 20, they go, would you rather look like a 20-year-old reptile or a 50-year-old human?
Yeah. I don't know. There's young girls that are just getting that shit done. There's a girl that I'm friends with, and I saw her, and she's like, "Oh, I just got my lips done." I asked her, I said, in front of all the other girls too. I said, "Why?" And
that's going back to social media, right? Everybody's pressured.
Yeah.
That was another thing. I spoke with my girls about that too. Don't ever, you're beautiful as you are. Do not feel pressured.
Societal norms.
Yeah, man. And unfortunately, there's a lot of young girls out there who are not mentally strong, who are falling prey to this. Where you just, everybody, man, your parents going to look at you and say, man, you're beautiful to me, and I think that's important for parents to constantly, instill that in their kids, give them confidence, and also for you to be confident, as a parent, if you're the kind of mother that every daughter looks up to their mother. If you're the kind of mother that's constantly, putting herself down or gaining weight and stuff like that, and you're not portraying yourself to your daughter in a good way. Same with a father. Listen, I try to be as confident as I can in everything I do because I want my boys to see that. I don't want them to see some guy that's like, man, he's out of shape. He's in, and it's funny because they've had their friends who like, man, I wish my dad was jacked. Like I wish, and it's like, oh, I take that as a compliment because I want my kids to know that, and that kind of, as they're young, that's going to stay in their head, and they're going to be like, fuck, I want to be that dad.
Even just instilling these lessons upon your kids of how to eat right, how to be healthy, how to take care of your own body.
I think that's important for the future, future generation.
Absolutely. Because
it sets you up for success, giving, like you said, you're making your boys work out, making them take care of themselves. That's steps in the right direction of keeping them healthy and giving them stability.
Yeah.
Because that's how kids get in trouble when they're younger. Right? They have too much free time, too much mind wandering and bullshit, especially with the internet. Now you're giving them, you guys got to work out. You guys got baseball. You guys got this. Keeps them on a strict line to make sure that they're staying the course of staying good boys and becoming men.
And know that they're mirror images. Like I tell
literally for you.
They're mirror images. So you know what? If the kid's an asshole, look at the father because the father's probably an asshole. If they're just going to replicate what they see all the time. Sometimes if they're not growing up with a dad, they're gonna take on a father figure and hopefully model themselves after that. But again, I think it's important, especially you talking about Nick talking about the social media and stuff for the younger generation. It's important to stay on top of them and let them understand like, hey, listen, that's okay to look at and stuff, but don't model yourself after.
Yeah.
Model yourself after, you know, your mom, your dad, your uncle, somebody who you could look at and say, wow, you know, this guy's got his shit together and he's aspiring and he's doing good stuff. And like I said, even if you post that out there, just, you know, look at that stuff too. You know, you want to look at your kid's stuff and say, what are you learning from this?
Yeah.
You know?
I keep liking puppies. That's all I do. I like puppies. I like camera equipment.
Right.
I like all that shit because that's all I want to see.
Right.
I just want to see that type of stuff. I don't want to see all the bullshit, all the people putting each other down, all the negativity.
Right.
I mean, even the motivational speakers, they get to be too much after a while. It's like, okay, we get it. You're all preaching the same shit over and over again. Grant Cardone, Gary Vee. I'm not saying they're not effective.
Right.
They're all great in their own ways.
Absolutely.
But after a while, I'm pretty sure I've seen that video on his page. Like
But that shit can get to you too, no? Don't you feel like
then you feel like you're underworking.
Yes.
Yep.
Yes, I was talking to my boy Armand about that the other day. Like they're like, oh, you should be getting to work early, stay until midnight, sleeping 3 hours, coming back, this and that. And I'm just like,
And putting yourself in the hospital.
What kind of life is that? What kind of life? Listen, I am all for motivation, trying to be the best version of myself.
Right.
Any girl that I date now, like or I see, I tell them, I'm super into positivity and all this shit.
Right.
You can't bring that? No worries. Doors there.
Right.
I appreciate you for who
agree.
you are, and that's there. That's great.
Yeah.
But for me, after a while, just listening to all the motivational shit and scrolling through and seeing this motivational post, you kind of start to feel like shit, like you're not at a good point in your own life.
Absolutely.
All the Tony Robbins and stuff.
I had to stop because I was like, wow, I'm getting like this negative vibe to myself. Like, am I not trying as hard? Like, am I failing here? Like somewhere, and then I'm like,
you're drinking coffee. You shouldn't be drinking coffee. You should be out the door already. It's like, oh shit, okay.
Fuck, I'm looking at it. I'm like, so now when I wake, when I used to wake up, I used to, go to the bathroom, whatever, and then as I'm on my having coffee, I used to scroll through and see some shit. Now I'm like, you know what? I'm not gonna look at this all morning, man. I'm just gonna check my emails. I'll check my texts. I'm not looking at any social media till later on in the day because I don't want to get my morning started like that. I might look at some motivational stuff like sayings.
Quotes.
Exactly.
Quotes are nice.
I won't look at anybody talking.
Yeah. The worst thing that I dealt with my prep was I was doing all my fasted cardio bevs. And they had like 4 or 5 TVs, and everything I saw was the news of all this. I wake up in the morning, I do my cardio. I'm just seeing negative bullshit around me.
Yeah.
And this is when all like the shootings and stuff are happening. So I'm like, what the fuck am I watching? I just woke up.
Yeah, you don't want to fill your head with that right off the bat. That's why I got to do that. What's the name of that app now?
Which one?
Dark Sky.
Dark Sky. But you have Android, right?
I got Android.
I have to see which one's best for you. I have iPhone.
All right.
Yeah, I don't think Dark Sky's. Maybe it is by now, but Dark Sky's my favorite.
I don't even have to turn on the TV in the morning.
It's the best way.
The window. You ever have that app? You ever download that app?
Is there such a window?
The window?
Oh, I thought you meant actually look out your window.
Yeah, I do. You just open the fucking window.
Oh, he's such an ass. He's such a fucking
I'm like,
ass.
wait, I'm like, why?
I'm pretty sure every house comes with it.
That's funny.
I wanted to touch on one more thing with you. I wanted to ask you, just obviously we kind of touched on it in the beginning. What's some of the more common things that you see in your office, whether that be injury-wise or just anything that you think that could be prevented with just minor tweaks within the day, like with me with the phone?
Headaches. I would say I would say with the everyday person, it's headaches and lower back pain. Most of us spend most of the day seated. So our hip flexors and our glutes get weak. Our hip flexors get really tight.
Yeah, you stretched mine out yesterday.
Yeah,
Shit.
so it's like you got to, if you don't stretch those out, all it takes is a little lift of something, or, when you get out of your chair and you're kind of slow to get up in a straightened position, that means your hip flexors are getting tight. So either get on a good stretching program for your hip flexors, and that'll help your lower back, or get to a body work guy, get some A.R.T done, get some fascial stretching, and get that tissue straightened out. And with the neck, it's chin tucks. Throughout the day, do your chin tucks, because most of us spend the day either with our chin kind of protruding out.
And you don't even notice. It's the weirdest thing. You don't even notice.
So get into the routine. I've had people that, really bad. And I've had people just put a little, like an alarm clock on their phone every 2 hours, every 2.5 hours. Just do 5 reps of 5-second chin tucks straight back to stretch that little suboccipital triangle. Just stretch those postural muscles out, and then go back into your work. That's probably what I see the most.
Okay.
Yeah.
That's crazy. It's wild that was causing vertigo for me in November. Was just those tight muscles. He opened those up for me.
Yeah.
Done. No dizziness. Yep. What the hell? You a witch?
That's
There's a witch in here.
But that's how, with this technique, it blew me away. Listen, I got treated when it blew me away in 2 visits. My shoulder was better. And, when I teach the technique, I tell the other practitioners learning the technique, I said, you're going to wow not only yourself, but you're going to wow a lot of patients with this technique. And it's pretty amazing, man. And listen, I don't consider myself, like I told you before, I'm not a big research science geek. When I learned the technique, I didn't even really care about all the background shit. I wanted Dr. Leahy to show me, when a patient comes in with this type of pain, what do I do? Mm-hmm. What muscles do I work to get that patient? Because my intent is to get you better when you walk into the door. I don't want to bore you with a whole bunch of shit background.
The jargon.
It's funny because we just taught the course not too long ago, and we had a gentleman who's uber intelligent, and he did the intro. Usually the lead instructor, which in this point would be me, I would do the intro to the technique, talk about the background and Dr. Leahy and how you get started and stuff. And I would get a little bit into the science of it, but not crazy into it because I knew that's not what the people were there for. This guy does all our research, and he got into the science of it, and you could just see he was like losing the people. After
people started nodding
30
off.
minutes, I'm like, oh man, this is not what they're here for. Like most of the people here, like, because it's all hands-on. The seminars are all hands-on. So we go over the anatomy. We show the anatomy on the front. We talk about when you would see this problem and what the patient might present with, and then we break up into groups and we work that muscle. And then all the students work it on me, and then I say, okay, you got it. We work in that group until everybody knows how to work that structure, and then we move on to the next structure. And then that's how we do it. And then we test on Sunday.
And this is done where?
All over the United States, and now it's in Europe and China and Japan and Australia. He's teaching the technique all over the place.
Cool.
Yeah,
that's awesome.
Yeah.
Yeah, the A.R.T. is great.
Yeah.
John?
I want to talk about some of the more the tools you have at your disposal. So I know you had that cold laser on me the other day, and I'm like, what the fuck is this thing?
Yeah, the cold laser.
Why didn't I get a cold laser?
He doesn't like you. He doesn't like you as much.
You got to wait a little while.
He's gonna snip my brainstem with the cold laser.
The cold laser is high-powered light. It's infrared high-powered light that creates activities in the cells and promotes recovery and healing in the cells. Mm-hmm. It's great for inflammation. We have a lot of older patients. Not a lot of older patients, but we have some older patients with like arthritis in their neck, even younger patients. And we use that on them, and they really feel a big difference. Acute sprains and strains of muscles, hamstrings and stuff. We'll use it on there just to kind of promote the healing process. So we'll do that first, and then I'll get in with my, with the A.R.T. and stuff like that, just to help that tissue recover a little quicker.
Yeah, because I know what most of it does. Like the stim and everything. I know it's something to flush nutrients and everything in there.
Right.
But the cold laser, I felt great afterwards.
Yeah.
I go, what the hell is going on?
Yeah.
He's like, it might
and you don't feel anything.
Yeah, and he goes, it might get warm. I'm like, no, I'm really confused.
Yeah. Some of the pulse, the laser that we have is pulsed, so it doesn't really get. There's cold. There's lasers out there that they're constant and they do get hot, but you really have to know what you're doing because you'll burn right to the bone. It's
crazy.
Yeah.
So you're saying John was more broken than me? That's why he needed.
He was
that.
a little bit more broken.
All right,
Yeah.
Yes, let's go. That's something to aspire to.
But yeah, the different tools that you have is important, but my main tools are my hands, but if I can have something, and it's funny how that cold laser came along, is my hands were killing me to the point where I was telling my secretary, like, we're going to have to reduce how many patients I see because I'm getting scared here. I was getting some tissue work done on my hands and it wasn't really relieving it. And a friend of mine who was having the same problem said, oh, you need to get cold laser on your hands. And I didn't know about cold laser at that point. Mm-hmm. And I called the guy, his rep up, and the guy came into my office and used it on my hands. And it was almost like instant, like the arthritic pain and stuff like that was like gone. I'm like, holy shit, it works that quick. And they're like, yeah, there's a problem there. And then, so I bought that little laser is like 10 grand.
I was about to say, what does something like that go for?
That's what the guy was telling me.
10 grand, yeah. So I bought it right away. Really selfishly for myself because I'm like, I need to use this every day on my hands and I could see, as many patients as I want. And then I started using it on my arthritic patients and then some, hamstring tears that came in and we started like, wow, this stuff really works. And it's been a mainstay.
Yeah, that's a cool little thing. That's why I ask.
Yeah.
Do you get into pain because you're working on so many people?
Yeah.
I was about to say.
It's cumulative trauma. It's just like repetitive stuff. And it's just, my joints and my thumb just were getting, really abused. And, again, to the point where, I was trying to work them out and I couldn't get the relief that I wanted to be in pain. Mm-hmm. And the cold laser works.
Durlan's fucking hand strength crazy.
My
man
got to go to college and I got to keep working.
My man can snap steel with those hands. When he gets behind my neck, I'm like, oh, he's going to go through my eye. I know the thumb's going to go through my eye.
That's funny.
I'm lucky he's my friend.
Sometimes patients come in and they're like, are you going to hurt me? I'm like, no, I promise I'm not going to. The best is
Depends on how you've been.
Depends if you pay or not. But on my website, I have a couple of pictures of old competitive pictures, and patients, sometimes they'll come in like, who's the guy in your? I'm like, that's me. That was me.
Yeah.
At one point, and but some of them get scared, and I'm like, no, I'm just.
That should make
I'm big.
That should make you comfortable because I can actually get in there. I'm not going to be like.
Well, it definitely comes in handy. Working on the big guys.
I'm sure
like,
you got it.
Yeah, what was it like working on? That's what actually. Real quick, what was it like working on Dorian?
He was pretty pliable.
Really?
For a big guy, and who was pliable too was Dave Palumbo.
Really?
They got pliable. The toughest guys are the powerlifters because they're just tight
and they have no flexibility.
And they never stretch.
Yes, and they're just their tissue's hard to get in. But bodybuilders, believe it or not, their muscles are pretty pliable. They're easy. I was surprised because I was a little, when I first worked on Dorian, I'm like, it was just his forearm. So I'm like, okay, again. And then when he said the hamstring, I'm like, wow, I'm getting into this pretty good. Then it was his shoulder. So I was getting into these. I'm like, wow, this. And I started noticing a lot. Like Victor Martinez came in. These guys are just very pliable. Like you can get into their muscle. First of all, the muscle's right there. So you can get into that tissue really, really easy. Yeah.
I've had the Graston done on me, and I've had a little bit of A.R.T done by Sarah. And and she did it a while back before I started seeing you. And she said your tissue is actually very soft and easy, pliable.
Yeah. I mean, it's a lot. It makes it a lot easier to work with when somebody comes in like that. And I find that with the bodybuilders and certain athletes, it's a little easier. Powerlifters, football players, they're a little tighter. They're a little harder to get into. But so that's where your size comes into play. When we teach the technique, there's some people in the class that are, they're 5 foot, a buck, maybe a small girl, and we try to teach them how to take advantage of, biomechanics and
like
setting your body up, and using different body parts like your fist and elbows to try to work that body part. Unless you're just going to have a practice that's made up of, smaller patients, smaller younger kids and stuff like that. But
it's only good for so long,
right?
Yeah.
If people want to do the certification classes with you and Dr. Leahy. Is that his name?
Yeah, they go onto the activerelease.com website. They'll have all the seminars listed on there. You click on the location, and you come into. I usually teach most of the courses on the East Coast, and
any coming up?
No, we just did one in Jersey. The closest they come is Jersey. They never come to New York because I think it's just too expensive. They run the whole thing. So in other words, they'll call me and they say, "Hey, we got a seminar in New Jersey or Atlanta. Can you teach?" Yes, I could teach.
Cool.
And then they'll send me there. But it's activerelease.com. That's the practitioners who want to take a course. That's where they go. And they just look up, see seminars, and they'll click on there, whatever seminar they want to take.
And then if people want to get in touch with you to have work done with you, you could plug yourself, like where the business is, where how they can get in touch with you.
I'm in Smithtown, Comac area, and phone number is 631-486-9100. And usually we can get you in either that day or within that week.
Yeah, you're just super accommodating every time I call last minute.
To get an appointment. And, patients have to understand that sometimes if they come in, they might have to wait a couple minutes. And I do not spend an hour on patients.
Which is good.
Yeah,
you don't need to.
You're looking to get in, and I'm going to do my work. I'm going to tell you if I can help you or not. Get you in, get you out, and get you back into the gym or back into running, get back into your sport as quickly as I can.
Cool. I know we got some Tame the Beast stuff for you. We're going to let you.
Oh, yeah.
We're going to get you buttered up. We're going to get you ready with all that stuff.
Yeah.
So we'll do that after this. But I want to let John kick this outro off.
So thank you, everybody, for tuning into this week's episode of The Voice.
And Rizzles, joined by Dr.
Durlan Castro.
That's my man right there. Peace.